And we're live, so you should be able to see it right now.
Who, Laurie? Oh, yeah.
Yeah, click on it and see what happens.
Yeah.
So what I did yesterday, and what I did 6 hours on Friday, and what I did through the weekend following this guy, so kind of an overview.
Yeah, it has a menu. Is that how it works?
Work functions, all the lifelines on too much of that, and then next time I'll
She said she touched the YouTube button and it has a menu. So you're not seeing any video?
have a copy of it.
Oh, she said she just seen
You know
past
where
me.
you're going with this stuff, you just have to get your connections and all that stuff done.
This is
your
day
arms
2.
around everything, and
This is Montezuma County YouTube.
good. Yeah, how's our PIO? What do you think of our PIO?
Have we been getting
Oh,
the
wait, yeah, he's gotta
information
switch
out though?
something,
Because
so
that's
hold
what
on.
I'm not seeing. Where are we putting it?
Don, are you supposed to be on that call at 9
What I
o'clock?
saw yesterday, she's putting it on my emergency manager's Facebook,
Okay.
she's putting it on the county, putting it on the
Okay.
website.
So then that's where we can look at it and then share it from there.
Trying to get the newspapers to follow this. Remember what I said, just take the message. We're doing this,
Saying something else, exactly.
Right,
Yeah,
it's
we
all
want
the
department,
same.
we are going through her.
right, and that's what we're doing, so
Good.
she's working with,
So do you see
the
anything
sheriff,
yet?
I talked to him, and he and the undersheriff,
Yeah.
they're the PIO, the sheriff, and I said, well, we'll make sure if we say anything about that.
It says live
And
now.
tell him to be sure he checked with Vicky as well.
But you're not seeing anything.
Sheriff, don't hold
I don't know,
yourself
we're
out
still
there,
working on it.
you're not a total island out there, buddy. Yeah, you get in line too, yeah.
Oh, you see it now?
So that the message comes out, this is what we're saying.
Yeah.
Yeah, 323.
Exactly. I don't want.
One message, so people aren't asking you, wait a minute.
That's it. Okay, we're gonna get started. Thank you.
Better open up, huh?
All right, let's stand and do the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, good evening, everybody. On behalf of the Montezuma County Commissioners, we welcome everybody. Trying times, we're going to get through it. And the first thing on the agenda is the minutes. Commissioners, have you had a chance to look at the minutes? And if so, is there any recommendation?
I have reviewed them and I move that we accept the proceedings of the Board of County Commissioners, Montezuma County, March 10th, 2020.
Second.
Motion and a second to approve the March 10th, 2020 proceedings for the Board of Montezuma County Commissioners. All those in favor?
Aye.
Aye. Motion carries. Okay, the second thing on the agenda is we have the public comment session. So this is our first trial run. Folks, be patient with us. But if you have any comments,
You can type them into the comment section on the YouTube. So there's going to be about a 20-second delay from when I'm saying this to when anybody would hear it on YouTube. And so then we got to wait a certain amount of time to see if anybody types anything. If they do, I'll read the comment out loud and you may choose to respond or not respond.
so we're just kind of sitting here waiting. If anybody has a public comment, if they would please type in per instructions of our county administrator, and we'll have a look at them. We're still waiting.
On live stream, you just walked down there, so.
30 seconds. But we still have them.
So Dana Knopfinger says, I'm here.
Thank you, Dana.
Okay.
Jimmy McLean says, it works good.
Good.
Does anybody have anybody out in YouTube land this morning have a comment or a question for the Board of County Commissioners? At this point, I see none.
All right, we will close the public comment period. First thing on our agenda is we have our new emergency manager for the update, Jim Spratlin.
That's him.
Good morning, Commissioners.
Good morning, Jim.
Morning, boss.
Morning,
City
sir.
Attorney, Clerk. So, hitting the ground running. I've got a report for you. Eventually, again, it will be a written report so that we can follow it together and if you have any questions. But for today, I'm still getting my arms around what's going on in our county. So, with that, let me give you some ideas. And it's a little bit jumbled because I was working on this late last night. But we had our Emergency Operations Center multi-agency coordinating group meeting yesterday, and we're going to have 2 of those virtual meetings a week. And we have the right amount of people involved in this, and that way people can call in. So we're getting all the disciplines and all the emergency support functions that we need in there, and we're getting all the information back. Public Health's done an outstanding job trying to keep up with this. And so it saves me a lot of extra work. So they've already created this group. Now we just turned it into a multi-agency coordinating group. So we've got the EOC basically up and running to assist in this, issue with the coronavirus.
Jim, just excuse me for a second.
Yes.
Well, I'm watching the live feed, and you can't see you in the feed. Shaq, has the camera been readjusted because of the 6-foot spacing? Are you see what I'm seeing? Kim, can you see what I'm seeing?
No, just push the podium in. The camera hasn't been readjusted.
Just,
And actually, it's down with the left.
oh, well, how come we've never fixed that then? I mean, people should be able to see. Okay, I think that's
Better?
more appropriate.
There you go.
Yeah,
Okay,
sorry.
good. No,
Sorry.
it's fine. So I'm going to throw a lot at you really quick, but San Juan Basin Health reported their first confirmed case yesterday of the coronavirus. And again, back to, we're going to get more cases because we haven't been doing the testing, and now they're doing the testing. They had 69 tests over the weekend. They're sending those in. By Friday, we should get results on them. They're going to do a remaining 31 tests to use them up this Wednesday. So we're going to get a lot from the La Plata County side. San Juan County, as you have read, we have 1 case confirmed in Farmington, New Mexico. So, and that they're going to be working on that. The Navajo Nation now has 39 cases. That may have gone up. I have not looked at my email recently. So, because of what's going on, our county's emergency management, which is me, and our health department together have built this emergency ops center. So we're off and running with that. We're going to put some more people in that. We want to keep social distancing right now. There's no need for us to meet physically. So we're just going to leave that. If it gets worse or something else happens, then we will meet at the sheriff's office in the physical EOC and have that 6-foot, 10-foot distancing and start working out of there if we have to. Right now, we're just still getting our arms around where we're headed. The national stockpile for items that we need was one of our challenges, is trying to get equipment. The health department was able to get some supplies, masks, gowns, etc. They'll be here in 1 to 2 days. Hopefully, I'm hoping tomorrow morning. And then they're going to be delivered at the health department. We've got a cache that we're going to put there. And then out of that cache, we have to distribute some of those items to Ute Mountain Ute, Dolores County, and then, of course, to us. Our priority, again, is the hospitals, make sure they have what they need, and then start distributing them out to other entities, that especially like health workers, hospice workers, things like that. So we're going to start working on that very soon.
Jim, I have a question real
Yes,
quick.
sir.
I saw that email that came from the state of what Colorado was allocated, and then they were distributing to the 64 counties, but do we have a number on what we actually
Not yet,
received?
no, sir. There's according to the health department, and that's who they're sending it to. She seems to, Karen Dixon, seems to believe that when this supply comes, we have a forklift ready, so to me it sounds like a lot, and she seems to think it's anywhere from a pallet full of a lot of items to what might fit in the back of a Subaru. Because they're telling us they're keeping supplies for all the hospitals, and of course, their area. So we've been fighting that, and that email that was sent, that the senator said that we have supplies and go to the web EOC and order them. We order them, but we don't get
Get
them.
anything.
So we're still working through the health department on that.
Okay.
Jim, they're saying that they put a comment that, could you get the mic just a little bit closer to
Oh,
you? They
sorry.
can't hear you as good.
Thank you.
Sorry.
Okay.
This is all new, so it's
I know, right? And
working through the kinks.
it sounds loud to me, but that's perfect.
Well, on the other end and
Right. Have them let me know.
YouTube land.
Okay? So I met with the city of Cortez shortly. We're going to meet later today. The majority of their staff is working from home, is what we got on the call from the mayor. I'm sorry, the city manager. And the police department, of course, their calls for service have increased. We don't know why. We don't know if that's related or not. But for right now, that's increased. I talked with the fire department chief yesterday. They're fully staffed. They are up about 50 calls from this time last year. And they don't know if that's related because of the health issues, but they're up on calls as well. So they're fully staffed. We're not going to any kind of minimum staff requirements. The Indian Health Services have reduced their staff, and they're soon going to bare bones. We don't know why. We don't know if that's related or not. They're still going to have a telephone doctor visits, and they're still going to work through that, and if they have to do home visits, they will. But the Indian Health Service, they're pretty much closing down to bare bones. Mancos, talking over there, I haven't got with Heather, but I've talked with Jason, and I'm going to get over there sometime this week. They're needing some supplies as well, so we're going to see if the health department can get them some items as well over there for
Jim,
different health.
excuse me, when you said the Indian Health Service, is that the hospital in Shiprock?
Yes, well, Toyoc,
Or just Toyoc, okay.
just
the
have a
clinic in
clinic.
Toyoc.
Okay, because I was hoping
Sorry.
you weren't referring to the hospital in Shiprock.
No.
Shutting down that much, it's just the clinic in Toyoc.
Just the clinic,
Gotcha.
yeah. And I've got a contact in Shiprock, so I'm going to get with him and find out what they're doing. Just get my arms around that. And then the police, of course, the police and sheriff overall, they're scaling down pretty much on the, as a law enforcement officer, you spend time doing proactive work, right? Well, at this point, we're slowing down on a little bit of the proactive, and we're just doing a little more reactive because of what's going on. And because of the jail, we don't want to overcrowd the jail. We're trying to cut back on, So we're still out there. We're still doing our job, but they're just slowing down a little bit, right? We're just trying to pay more attention to the reactive. Transportation, we didn't get a lot on it, but I talked to our transportation in the county. Their ridership is dropping, and it's normally it runs 50 to 60 a day. We got 10 to 20, so it's dropping down, which I think is a good thing. The school district now, meal service starting on the 30th. Mancos schools are starting with on the 30th. The schools students are picking up supplies. Most of the schools in all the counties I've talked to, this is their thing. They're going to start, getting food service out to the kids. So,
But that's not till the 30th of March? They're not going to do that until the 30th
yep.
of March?
Well, Mancos schools, the students are picking up the supplies, but they said they're going to start the food service on the 25th, tomorrow, and then from then on, it'll be Monday and Wednesday.
Gotcha.
So that'll start working. The sheriff has reduced some of his admin staff, but of course his regular patrol and, the detentions is the same. He's trying to reduce his inmate population, so they're down somewhere around 72 instead of 104. So he's trying to get that down, and then transportation out of there for other issues. We're trying to keep the extradition down for warrants, but you know, when the judge signs a warrant, you gotta go get them. But that's what we're going to work with, and try to get that to where we're not doing a lot of transportation and bringing people from the outside in. So sheriff's working on that. I spoke with Bridge Shelter and Laura, and she's opened up, the rooms are opening now. She's got the spacing going on in the bunk beds. Normally she runs about 40 plus people. She's running 30, not as many, spending the night. She still has 12 in her staff. She has funding to last until April 17th, then she closes the doors. So our vulnerable population at that point, I don't have a full handle on total homeless population in the county. I do know of the camps and where everybody's at.
Yeah, down in the canyon here.
Yeah, and
There's
we
people
went.
living there.
We went yesterday and did a recon and checked it all out. So I'm getting some figures back eventually. Some of that, they go back to the Navajo Nation, some don't. So I don't know what we're going to be looking at for this vulnerable population after the 17th. She said, the only funding she gets, of course, is different ways, 501c3. She said it would probably take at least $30,000 a month to keep her running. So that would, that's wherever she can get that from.
April 17th, typically they're the time that they close anyway, because they're only open for isn't it like November through April?
Right.
So
Right.
April is when they typically close?
Yep.
Okay.
So
Around
this is her
April.
normal closure.
This is her normal closure.
Gotcha.
And the other challenge we have, if she did get funding to try to keep this going so we don't have that population issue, that her staff of 12 know that they're closing in April and they're going to go to their second jobs. So she may not be able to have the staff as well. So she's working on that. A couple challenges. The one I already mentioned was working on supplies. I'm still going to order. I've got the power now to order, so I'm going to order, and I'm going to work with the health department and see what we can get for even our county members, for you guys, anything in the county that we can bring in, especially the hospital. The other challenge that was I just found out, and it's a legal one. I don't know where we're going with it. I'll figure it out once, but I just want to let you know. So the animal shelters, they're on the critical list, and we want to keep the animals. A lot of people are getting rid of their animals, so we got a lot of animals. To be able to send them out and adopt them somewhere, you can't give them out by law without them being neutered. But the vets are closed down and nobody can neuter. So we're in this,
Oh, really?
it's not an essential service. So
I thought that was just human essential, not elective service. The
yeah, and I'm
elective
hearing,
stuff is,
well, I don't know. I haven't looked at my list of essentials, but
I'd check that out closely, Jim, if I were you.
that's what I'm going to do, because
Yeah,
we need to
yeah.
do something there.
Yeah.
So I was talking to the several people. So that's one of my, I'm going to work on that too and figure out where we're headed with that. I mean, I can't force people to do things, but if it's a legal thing that the county can change,
Yeah.
great. If it's a state thing, under Emergency Act, maybe we can do whatever we got to do. I mean, I don't know. But those are, I got a lot of little challenges and we're working on them. But these two, getting supplies and dealing with the shelter right now, and then the homeless, of course, where are we going with that? So that's
Well, I
my,
think there would be a way, so you have vets for cows, sheep,
right.
and that would fall underneath the agricultural exemption. Working dogs, maybe you're looking for a ranch dog, but I believe that there would be a way to work around that. That
I would
it's essential. It's a life. You got to have a doctor for the animal as well.
Right. And I wonder if it's no different than some of the things we're doing, like dentists, you have an emergency, then you can go
Yeah.
in. So maybe we can find a way to make this work. But that's my plan, either today or tomorrow, to get with the shelter and really maybe find the truth in this.
Yeah.
And see what we can, and maybe it's not an issue, but I'm hearing it's an issue, so.
I'm looking at the order right now and reading it. It says pets, what about my pets? And it says that veterinarian services will remain open, and it doesn't show restrictions on them,
Okay, good.
from what I am reading right now. So this is the order that's as of 8 o'clock
Okay.
this morning.
So I'm wondering, and that's a good discussion, I'm wondering if their services are open, but not essential, non-essential of
It depends on
neutering.
how they're restricting them or
surgeries.
how they're complying with their 50% maybe.
Correct,
But as far
correct,
as
it might
the
be their
services,
interpretation of
yeah,
it.
they're
So,
open.
So, I've got a couple of messages in on that. One is from Haley Leonard at Axis that's watching. And, shout out to Haley this morning. Morning, Haley. She says that the foster organizations will have you, sign a contract and pay a deposit for the spaying and neuter that you get back once the animal has been spayed.
So you can take them.
okay,
Karen Dixon does say that the governor's order is correct about that services. So I don't know which copy I mean, he's changed orders so many times in the last week, I don't know which one it is.
Yeah.
So I think that Commissioner Candelaria's would be the one that's up to date. So this is the phone call that I was on with multiple commissioners, was that the governor's shooting from the hip. The orders are supposed to be coming, the executive orders are supposed to be coming from recommendations from the health department, the state health department. However, the governor is making executive orders. It's working actually the opposite. He's given the order to give to the health department, and then they make the recommendation, and then he turns around and makes an order. And so they're making a lot of mistakes.
Yeah.
right.
And, go ahead.
I was scheduled for a dog neutering today, and they said that they canceled all electives. Anything emergency, they will do surgeries, but no
Interesting.
electives.
So they've done that within their own divisions then,
I think
Yeah.
by
so,
choice, by choice.
yeah. So I think that's still, we got some miscommunication going on. So what I'm gonna do is find the truth and bring it back to you, and then we can go from there. I think that's the way to go, so. Any questions? That was my short, hurry up, get something going report.
Keep
Should
going.
talk in here. All right,
That's what they say, when you're going through hell, keep on going.
just keep on going. We're gonna make it.
Yeah.
A little bit about the hospital. You are obviously communicating with the hospital.
Yes,
And all of our messages are going out clearly and together, so that it shows a unified command of everything that's happening
Yes,
within
sir.
our entire county.
yes, our public information officer, Vicki Schaefer, she's been sending out a lot of messages, and every time we get an update from the governor or a change in any kind of critical infrastructures or critical services that we need, she gets a copy, we post it, so it's on our social media page, it's on our county's webpage, it's on my emergency manager's OEM page. And Shaq, do you know where else we're posting that? We got
You said she was trying to get it to the newspaper and all that as well.
newspaper,
and,
We are posting to the website, to the Facebook page, to the Emergency Operations Facebook page, the Montezuma County Facebook page, the Montezuma County Clerk's Facebook page. The messages are also going out to the Journal, KSJD, KVFC, KRTZ, KISZ, and KKDC.
wow. And it's the same consistent message, built upon what we're getting from the governor, what we're getting from public health, and what I've got. So it's kind of, it's gonna stay that way. So we're not confusing, our citizens, so.
If you have the opportunity, encourage the sheriff, Vern and Steve, to
Yes.
work through our if they at all can, to please work through Ms. Schaefer on what they're needing to put out there, because that one source is very important, that we don't have other voices coming in when we've got a public information person for the county, and that's for the whole county, so.
And I did see
Encourage.
Shaq's email. That did go out countywide, that is a directive.
Yeah.
All of the information is to be put out by our new PIO.
Yeah. Well, just
So-
need to maybe reiterate it to the sheriff.
I'll do it.
I do have a couple of YouTube comments. First of all, Lindsay Yeager from Southwest Health Systems says she will be available if you have any questions for Southwest Health Systems. So, and then several people have commented that the reason for the cancellation of elective pet surgery is to save supplies for what could be necessary human life.
Okay.
Yeah, I received that as well. Thanks, Shaq. Any other questions, Commissioners, for Jim?
Keep going, buddy.
No,
Keep
I
going.
want to thank you for starting day 2.
Yeah.
I know that
Jumping right in.
we've all been, working diligently to get
Yes.
these interviews completed and to get you on board, and thank you. I appreciate it, and I know this is day 2, but
It's okay.
we're all here running together, so thank
That's
you. I
it.
appreciate your
It's our county, we're gonna make it work, and thank you for the job. So,
All right,
we're gonna do a good job.
thank you, Jim.
Thank
Thanks,
you.
Jim.
Thanks, guys.
Next on the agenda, we have the emergency food funding request. It's a mutual aid coalition. Is it Delaney,
Delilah Darland.
Delilah, Darland, and
And Laurie
Laurie
Hall.
Hall?
So Laura and Delilah, if you'll unmute yourselves at this time.
Yep, I'm here.
Hi, I'm here. This is Laurie.
Good morning, Lori.
Good morning.
Good morning.
Good morning. So
Morning.
we're here to ask commissioners and taxpayer support for some COVID-20 or 19 funds. We're seeing a lot of needs for more food in our community. Our seniors are needing support in this time of uncertainty. We want them to stay home and stay healthy. MoCo is now delivering for senior services as of yesterday, and the health department has signed at least 20 more seniors that would like to have meals that we got from our Nail It Down program. The Share House has also been providing extra meals and baked goods for about 20 of those seniors that weren't getting the senior Meals on Wheels. We are anticipating that number will grow now that we have added more normal meals to go along with the Meals on Wheels, so that they have extra meals for the days that Meals on Wheels doesn't provide meals, which is Tuesday, Saturday, and Sunday. So we're trying to provide 3 extra meals a week for those seniors to stay home. Let's see. Volunteers are also doing some shopping and medication pickups for a few seniors. Every time we call, we ask if there's anything else they might need. At this time, there's lots of volunteers in our community that are really willing to help out. So I just want to shout out to them, say thank you very much for volunteering their time. I just wanted to do an update on the schools. The schools are now providing sack lunches as of Monday, March 30th, but the Share House has, and Pinion Project has picked up about 100 students that need meals as of yesterday. So that kind of threw us for a loop, but we got enough food, I think, to get them through the week with some fresh fruits and vegetables and sandwiches. I'm also hoping to add a senior grocery box on Friday to the extra meals that we'll be sending out on MoCo, just to make sure that our seniors have enough food in case there's a shelter-in-place scenario that happens in our county. Let's see, what else? Amber Lansing of the Dolores Family Project has seen a double in the amount of participants in her program. She does a backpack program, and right now she's doing curbside pickup. So they're allotted 15 minutes to come in and pick up their backpack, get out of there so that the next family can come in and pick up theirs. Gretchen and Mankus at the Mankus Food Share House, seen 85 participants yesterday for the commodities program. They had their commodities dropped and 85 participants showed up for that. Good Samaritan and the Share House have seen at least a triple amount of participants coming into their facility. And we were open last week 7 days. I think this week we're gonna stick it just 6 days. So right now we're asking for some financial support, $2,500 a week. 2,000 of that will be going to Dolores Family Project, the Mankus Food Share, Good Samaritans, and the Share House. and then 500 as a stimulus project for our restaurants to help us with meals for the seniors. And that's about all I have. Is there any questions?
Commissioners, you have any questions for Delilah at this time?
Well,
I have a question, Delilah. You said you were asking for $2,500 a week. Do you have an estimate on how many weeks you're thinking at this point?
We're thinking about 8 weeks. Hopefully that's all. Hopefully that is all we'll need. We're also trying to get some separate grants to supplement that income too.
That was going to be my question also. How many weeks were you looking at, Delilah? Which, obviously, 8 weeks is $20,000.
Yeah.
Delilah, I have a question in regard to seniors. I know our AAA, the statewide, I believe it's statewide, I'm not sure if it's our AAA in the San Juan Basin area, but we've gotten some extra funding for Jonathan and our senior center and to do senior nutrition, home-delivered meals. I know there's a growth in that, and we have funding coming into Montezuma County to hopefully accommodate those seniors that are going to be going from congregate meals to home-delivered meals. So I want to be sure that we're not that you're not stepping into an area that our AAA, our Senior Services Center, has already amply covered.
I'm not sure about that. Jonathan hasn't spoke to me about that at all. So all I know is that we have been providing for the congregate meals.
You've been providing what for the congregate meals?
Extra meals for them for Fridays, for Tuesday, Saturday, and Sunday.
When the senior center doesn't?
That's when the senior services are not delivering.
I got you.
Jonathan is I see that he's on the screen. Does he have any comment to make?
Are you asking me, Commissioner? This is John.
Yeah,
Yes,
John.
sir. That's my ask.
Yeah, okay, just the audio is a little difficult here. I have not heard from any other agency other than long-term options on the need for home-delivered meals. I haven't heard from Karen, Sharon, others for this need that I'm now hearing about. When we have included everybody that long-term options has given to us as a home-delivered meal, so they're getting a home-cooked meal now. And then I have secured frozen meals, delivery of frozen meals. I've kept Shaq informed on those numbers and the amount of meals coming this way. So we do have that soon that will arrive here. I've let Shaq know what we can do as far as our capacity to cook meals, the numbers that have increased. We saw a big drop of our on-site people who now are in the home delivered category not want the meal. So our total from long-term options, I think, is 8 or 9 clients that we've now received from them who are seniors who are needing a meal, and they are getting it now. I haven't heard of any others. I haven't heard from seniors needing meals aside from what has been brought to my attention.
Okay.
Do you know how many meals went out yesterday? Because I know that our congregate that we have reached out to that does the Nail It Down program, I know that they also went through the senior center yesterday. So did those numbers go up, Jonathan?
I guess I don't know what you mean they went to the senior center. So we're doing about 20, it's 20 additional home delivery, but half of those are, or 11 or 12 of those are normal clients as it is. We've only received 8 or 9 new clients for a home delivered meal that were kind of expedited into the system. And they all came from long-term options. I have no other list of clients you're serving meals to as far as cross-referencing.
Well, we've been picking up Kathy and a couple of our other employees here at the health department have been picking up about 15 extra meals to be taking out. I guess my question would be to Jennifer Morris then, how many were delivered yesterday that she knows of?
Are you there, Jennifer? We see you on the.
Jennifer, are you there?
Well, we have 20 on our list, and then we have Community Connections delivering meals. I know Moco's delivering meals. We have our regular meal drivers, and then I know what the health department is picking up those extras. And my understanding is the health department is doing the long-term options extra meals plus maybe a few others. I mean, every morning I'm typing up the list. I sit here and
Jennifer, are you there?
I am here. Hello.
Yeah. Delilah
Can you hear
has
me
a-
now?
Delilah has a question for you, Jennifer.
I have a question for you, Jennifer. How many participants were meals taken to yesterday?
I'm here. Can you hear me?
The health department is picking up those extras.
Okay, let's all be quiet for a second.
My understanding is the health department is doing the long-term options extra meals plus maybe a few others.
Feedback.
I mean, every morning I'm typing up the list. I sit here and
Can you hear me now? I am here. Hello. Can you hear me now?
Delilah has a question for you, Jennifer.
I have a question for you, Jennifer. How many participants were meals taken to yesterday?
I'm here. Can you hear me?
picking up those extras.
Okay, let's all be quiet for a second.
My understanding is the health department is doing the long-term options extra meals plus maybe a few others.
I'm working on it. I'm muting it.
I guess I have a comment or a question.
Go
I
ahead,
think what
Commissioner.
you're trying is so that we're not duplicating the efforts.
right.
Which is what we don't want to do.
Right,
Um,
I would like for our AAA, our senior services, to take care of taking care of the seniors in our community, and I think that's where we should direct whatever funds. If there's additional monies needed at our senior center to do the congregate or home delivered meals, now that we're not doing congregate, that we sustain that effort as much as we take Delilah and Laurie's. I think they may be involved with other people other than seniors for providing meals and congregate stuff. So I just want to be sure that our seniors are being taken care of through our senior center and our MoCo and delivering those meals to them through our senior center.
So, Commissioner, what do you suggest for the Tuesday, Saturday, and Sunday?
Well,
Do you
that-
want the senior services to work additional hours, or do you want to direct?
Can you guys hear me now?
Yeah.
Yeah, we can hear you, Jennifer. How many meals did you deliver yesterday?
I don't know.
Did you hear the question?
Can you guys hear me now?
I think we're still on the feedback loop.
This is Jennifer. Hello.
She's probably muted.
Yeah, Jennifer, can you tell us how many meals you delivered yesterday through the Transportation Department of Montezuma County? MoCo.
You could text her.
Do we have a way to,
I think
John's gonna.
John's going to try to get her on a cell phone or put her on speaker, but I think I know where you're coming from, Commissioner, and I would agree with that. So, but you bring up a good point, Shaq, for the other days that we're missing so that we cover the full week.
Right,
So-
and I guess what it points up to me is that prior to, we weren't covering the full week for seniors. Obviously, we had our days that our senior center provided meals. Now,
You know how many meals we did?
now we're moving to a 7-day a week, that the seniors need a seven-day a week, and I guess I'm not sure why that changed from,
Well, I think it's probably just because they're staying
Staying
home
in.
because they're in the elderly population
they can't.
of 65 probably or older, would be my assumption. I can't say that for sure, but that would be an assumption based on,
Yeah.
I have to
On
shut down
them
the
not doing
feedback
what they're
loop.
doing.
Did you hear it? Okay.
So, Delilah, have you had a conversation with our senior center director, John, about this issue?
I haven't had a conversation with him.
And why not?
We've just been working on what we needed to work on here at the health department with the seniors that we have for Nail It Down. And so this is how we were we were working with that. We were they're buying senior meals from the senior center, and then we were taking them out, and then we were making extra meals for Fridays, or for Tuesday, Saturday, and Sunday.
So why didn't you tell our AAA, which you're getting some of your meals from them anyway, our senior services, that, hey, we've got these 15 clients on Nail It Down, and we need to start finding a way to accommodate them 7 days a week? Because I think that's how, well, just my take. I think Jonathan and our senior center can handle this through MoCo and our delivery drivers, and they've got the capability to build the meals. We just I think we need to keep this centralized in through our senior services.
Do you have anything to add to that, Laurie?
If they have the capacity and the employees, then that would be great. I was just under the, I just was thinking that they were just gonna do it those days.
I think maybe.
I'm here if you can hear me now. This is Jennifer.
Hey Jennifer, I was just wondering how many deliveries you guys made for the senior center yesterday?
We probably did around 20 or so. We had the one that the driver that I had told you was going to do yours ended up doing a different route. So we didn't end up doing the right routes, I don't think. But I had sent 2 people out to help with the senior center with their meals, and then I had sent one to get yours done for the ones that can't qualify for the home delivered meals.
All right, thank you, Jennifer.
Thanks.
Is there any additional comment before the commissioners make a decision?
Hi, this is Laurie. I have an additional comment.
Go ahead, Laurie.
Thank you. Just want to say that the share house has a very robust request line that we have made available to the entire community. When we get part of the population that calls in for food assistance is seniors, and we're getting a lot of calls, and they might not be people who either qualify or are in the system at the senior center, and it seems in this time of emergency, everybody should be doing whatever they can to reach this population of our seniors, because they're afraid to go out, they're afraid to go to the grocery store. It's dangerous to have elderly people delivering meals to elderly people. I'm not saying that's specifically happening with the senior center all the time. I'm just saying that our protocols for health safety are very strong, and we're getting a lot of requests.
All right, any other comments, commissioners? It sounds like, before we was to proceed, to me, that we would need to have a conversation between you guys and John.
Yeah,
Would
amen.
you, commissioners?
I would like to see that. I think everything should be coordinated with John, through John, so that,
Yeah.
to make sure that we're not duplicating it, but to make sure that everybody is being taken care of is our concern. So is waiting 1 week to approve any kind of funding, is that going to be, it doesn't seem like that's detrimental yet at this point in time. We still have some planning that we can do. Is that correct or not?
Would anybody like to respond to that?
Okay.
Was everybody able to hear what Commissioner Candelaria said?
That we need to try to work on some more planning before we ask for more money, is that what he said?
Basically, if you put your plan together and then it all, make sure that it's coordinated and come through Jonathan for us. 1 more week, is that going to hurt right now?
I don't think so, but I wanted to have Kathy talk a little bit about why we started taking on those congregate senior center clients so that they didn't come in anymore. So I'm going to let Kathy kind of take over, because she knows more of the understory about that, because I've been working on students and families and seniors too.
All right, well, go ahead, and then we're going to move on.
So I just wanted to say that we had learned that the congregate meal clientele that was coming to the senior center were offered to have their meals delivered or pick up, and most of them had chose about 20 of them had chosen to pick them up. So they were being allowed to come to the senior center and pick up their meals. I had phone calls here at the health department from family members, et cetera, that really didn't want their seniors family to come to the senior center. But so just as an emergency precaution, on Thursday, I believe it was, starting Friday, we gathered those names and several of us volunteered here, 3 of us, to deliver those 20 meals. On Friday, we delivered 14, was all that was on the list. And in addition to that, the share house had given us 2 meals for each of them to take along with our original 14 meals, so that they would have a meal on Saturday and Sunday. Then on Monday, we were given the list, and it was 22 people long. I had phone calls from seniors to add. I added 3 more to that. So we delivered those. We also delivered a meal given to us by the share house, so that they would have a meal on Tuesdays. Or Tuesday, as in today. We will regroup for tomorrow. Yesterday, I was a volunteer short, so I contacted MoCo to assist me in those deliveries yesterday. So that's where I'm trying to get MoCo involved to help us, because we were just as an emergency going out ourselves as volunteers and delivering those meals. And Jennifer's been extremely awesome with me in helping me route and keep those drivers, 1, employed, 2, able to deliver, and 3, the most important, is meals to seniors.
So I would like to meet with Jonathan and Delilah and Laurie at 8 o'clock tomorrow morning at the annex. And I think the commission can make a commitment. The meals will go out every day, and we'll figure out how to make that work.
Absolutely, and I think there's funds out there to do that, and I think it should be coordinated through the senior. They've got MoCo. You've taken the people with congregate meals and are now replacing them with home-delivered meals. And Kathy, it should have gone through Jonathan and through MoCo to start out with. I mean, those are meals that are prepared at the senior center, and that's where the way they should have gone and the way they should go.
And I think there's been some discussion around that. I know there's been some earlier meetings, but I will meet with them tomorrow and we'll get it nailed down. Yeah, and
then we'll have a request next week.
And if I need funds to make something happen this week, if you give me the go-ahead, I'll just make whatever needs to happen this week happen, and then Tuesday we can rediscuss what that looks like long-term.
Yeah, we definitely, John's the place where you need to go to from there, and then it branches out. So.
One week is not going to hurt.
No.
Delilah just stated that. So if you can communicate that and coordinate that, I think we'll be.
We will have our meeting at 8 o'clock. It'll be Kathy, Delilah, Laurie, Jonathan, and myself tomorrow morning at the annex, appropriately socially distanced, 6 to 8 feet apart. And then if the commission gives me permission to delegate whatever money is needed for this week, I'll do that, and you can rediscuss next week.
All right, so is that okay,
That's fine by me.
Yes, sir.
Thank you, ladies. We
Thank you, ladies,
appreciate
and
your
hopefully you'll have a productive meeting tomorrow.
All right.
Hi, this is Laurie. Hello.
Yeah, we can hear you. Go ahead.
Wonderful, thank you. So part 2 of Delilah's and my presentation this morning has to do with supporting our farmers and ranchers. The share house is raising funds to purchase and distribute food boxes when the Good Samaritan is closed. We're also looking to support our farming and ranching community. At this time, a lot of our farmers and ranchers rely on their town jobs, essentially, to supplement their income from farming and ranching. A lot of those town jobs have been laid off, and that leaves our farming and ranching community somewhat vulnerable going into the summer. The normal market channels for a lot of these growers are looking pretty dismal for the coming spring and summer. So I have a proposal I'd like to read. We are fortunate in Montezuma County to have dozens of fruit, vegetable, meat, and egg producers. One of the few blessings of this emergency is that now is the time to plant for the upcoming season. With many producers seeing their market channels disappear as restrictions are imposed on the general public, the Montezuma Food Coalition's Share House is looking for ways to direct products that would normally go to farmers markets and restaurants to people in need. We are planning a CSA type of program that would pay farmers and ranchers upfront for goods to be delivered to food assistance organizations via the Share House over the next 6 months. We respectfully request $75,000 to implement this program. We are receiving some funds from local donors and grant applications are in the works, but time is of the essence as the growing season is upon us. Without help from programs like this, our local producers are faced with devastating losses this year and difficulty in maintaining operations into the future. I realize this is a pretty big ask, but I genuinely believe it's a pretty big need, and I welcome questions.
Do you commissioners have any questions?
Well, this is new to me, Laurie, and I'm just not sure, I'm not sure how you need $75,000 of county money to, what are you going to do with that money?
This will be paid to support a CSA-style program
The
that
CSA, tell me
will
what CSA,
provide funds
tell me what
to
CSA
farmers
is,
at the
please.
beginning of the season to help
Lori,
with them.
can you tell us what
Yeah.
CSA is?
Oh, I'm sorry. CSA is community-supported agriculture. It's a style of selling in the retail marketplace that started probably about 10 years ago. And on a national scale, it's become a very popular way to sell products directly to consumers that supports the early season costs that farmers and ranchers incur to guarantee them some product sales throughout the season, and has been proven to be very successful. Southwest Farm Fresh has been running a CSA program for a few years, and it really makes a big difference to the farming community. And so the reason for styling it this way is really to provide some assurance to our local farms and ranches. If you broke it down into providing this program or offering this program to our local producers, it might look something like $5,000 per producer for 15 producers, or $2,500 for 30 producers. We would design, we're in the process of designing an application process to make sure that everybody who benefits from this program goes through a rigorous vetting process, and we will be approaching farmers and ranchers who currently sell in the wholesale and retail marketplace.
All right, thank you. Any other questions, commissioners?
I think again that I think these asks are just going to start coming, and I mean we have two in front of us today. I think they would be better, not necessarily in this meeting here today, but maybe to take place with you, Shaq, so that you can then get it back to us, because these are all dealing with this public health emergency.
Yeah.
We can meet day to day and be compliant with everything else that we have to do, and then see what really are, or what we can fund and what we can't fund, because we have to start shuffling our budgets right
Yeah,
now of
this is a
where
large
we're at.
This is a large unbudgeted ask.
Correct.
Lori,
So
can
we're gonna
can
have
you
to-
shoot me a detailed email with the breakdown of how you see this working, with quite a bit of detail in it, please, and thank you, and then I'll follow up with you.
Yes, I'd be happy to. Thank you, Shaq.
All right, thank you.
Thanks,
Thank you.
Thank you, Lori.
Ladies, we're going to move on next to our Noxious Weed Department. Bonnie, go
Morning,
ahead.
Bonnie.
Good morning.
Good morning. Okay, so today, so I got a grant through the Water Reserved Fund for $16,840, and that is to purchase a mulcher attach head. for an excavator. So last year we rented them for the program, and it cost about $4,500 to rent the mulcher attachment head a month. And then it cost another $4,500 to rent the excavator per month. So this is going to help the cost for landowners for this program. So I have two bids. One is of a FECON unit. And initially it came in at $21,513. And the next bid is the other type, which is a FAE mulcher attachment. And that's from Southwest Ag in Bayfield, and they came in at $21,500. My grant is $16,840, so I asked these guys if they could maybe meet me in the middle, and I could use some of my project rollover money from the landowner match from last year. The Southwest Ag would not lower their price on the FAE mulcher attachment. However, the FECON did lower their price to $19,000. So I'm requesting permission to purchase this FECON attachment for the $19,000. I'm going to use the $16,840 from my water supply reserve fund grant, and then I'm going to use the remaining $2,160 from the project rollover from last year. None of this came from county money. It's all from the grant projects and then landowner matches.
You'll still have to rent the excavator to run the brush head, right?
So Bonnie, Commissioner Ortel just asked if you would still have to rent the excavator to run the brush head?
Correct, and I got rental estimates from both Southwest Ag and the FECON, and the FECON estimate was less than the Southwest Ag.
What exactly was
But
that?
all the grant money, I applied for like 4 different grants for the project for this year. I was awarded $25,000 for one crew salary so far, and then I think $7,000 through HPP to cover salaries of April. So all this is just, it's the grant funded program. It's not through the county.
Gotcha.
Does that make sense?
Yeah.
So none of this money is coming, it's all grant money?
Correct.
So, Commissioners, how do you feel? You ready to make a vote?
I am.
Motion?
Yeah, I would move that we grant the Noxious Weed Department the latitude to purchase the Takuchi TB 290 brush bull hog attachment for the purchase price of $19,000.
Second.
Motion is second to approve the purchase of for $19,000 for a mounting bracket for the TB 290 brush head going on the mini excavator for 2020. All those in favor?
Aye.
Aye.
Aye. What else do you have, Bonnie?
They voted unanimously, Bonnie, if you didn't hear it.
Okay, perfect, thank you. And that's it. I was gonna, I have some ATV bids, but I think with the situation we're in with the virus, I'm just gonna hold off on purchasing a new ATV. I think I'm gonna go ahead and try to sell that old Polaris ATV and use that money to purchase a sprayer that we can put on our new UTV.
Okay.
So I think that'll be more cost effective, and I think that'll work for our crews to get by.
All right, so one thing about the sprayer, so I guess you've seen the setup that Eddie Lewis and Mr. Bruner have set up the sprayer. Can you hear me okay?
Bonnie, can you hear Commissioner Sukla?
I can't, but I can hear you good. Can you
Okay,
repeat?
so he said, have you seen the sprayer that Eddie has set up?
Yeah, and I personally have set up a sprayer like that as well. And I am planning on making the county one. I was too busy this winter. But really, for what we need, I just want to get a sprayer that'll sit in the back of that UTV, and I think that'll do everything we want. And then I'll just use that one ATV for our road yards and our gravel pits. So I think we'll be okay with what we have.
I guess, but you might have to repeat this. So I am talking about one that sets in the back. That, yeah, that,
Commissioner Sukla is talking about a sprayer that would sit in the back of your UTV.
so it's actually my cousin. He has built one. I
His
want to
cousin
make
has
sure
built
that
one.
we don't go out and purchase a high dollar when these farmers are very resourceful and actually can build a better product by buying a bigger pump and buying two 35
He just
gallon.
wants to make sure that we don't purchase a sprayer for the back that's unnecessarily high-priced when there's ways to make one equally as efficient.
Yeah, definitely. I'm in agreement with that.
Okay. All right. Anything else, commissioners, for Bonnie?
Nope.
Thank you, Bonnie.
Anything else for us, Bonnie?
Nope, that's it. Thank you.
Thank you.
All right, next on the agenda, we have the Department of Social Services, Gina Montezuma and Laurie Higgins. Welcome. Can you hear us, Gina?
Good morning, I can hear you. You sound a little muddled, but it's okay.
Okay.
Can you hear me?
Yes, we can. Why don't you, can you proceed? Is this our monthly meeting? Is this what this is?
Yes.
All right. Well, the floor is yours. The floor is yours, Gina.
Oh, the floor is mine?
Yes.
Okay, Lori and I are both here. Are we looking at the finances?
I'll tell you what I pull up as I pull it up. The
Okay.
first thing I am pulling up is the Department of Social Services February record of proceedings.
Those are the minutes that need to be approved?
Correct.
Commissioners.
So, I would move that we accept the record of proceedings for the social services for the month of February 2020.
Second.
There's been a
Thank
motion
you.
and a second to approve the record of proceedings for the month of February for Montezuma County's Social Service Department. All those in favor?
Aye.
Aye.
And the next thing I've put up on the screen, I don't know if you see it on YouTube or not there, Gina, I think you should be able to, is your February financial statements.
That monthly expenditure is 1.364 million, is that correct, for the month of February? Is that correct, Gina?
Gina, monthly expenditures of 1.3 million for the month of February, is that correct?
That's correct.
Okay, you're standing your percentages. So I will move that the financial statement expenditure report from our Department of Social Services for February 2020 be approved.
Second.
There's been a motion and a second to approve the finances for the Social Service Department of Montezuma County for the month of February 2020. All those in favor?
Aye.
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 Okay, Gina, the next thing that
Hold on, I'd like to say something.
Go ahead.
Regarding the expenditures and our finances, it'll be interesting to see what this look like in the next 3 months in terms of the expenditures, because we're going to have a whole lot of folks applying for TANF, et cetera, because of their loss of jobs. So it'll be interesting to see how these numbers change in the next couple of months. I just wanted to note that.
All right,
It's
thank
also going to
you.
be interesting to see how much the state helps you out to deal with these problems.
Can you repeat that, Shaq?
Commissioner Tell said it'd be interesting to see how much the state's willing to pitch in and help with these upcoming problems.
Yes. I just want to note a couple of things before we go on to the next slide. We were backlogged as it was because of CBMS transformation, and we're getting a lot more applications for TANF. We're using the drop box outside. We also are, hold on just a minute. We're using the drop box outside so people can put their applications in, and we're doing telephone interviews for the most part. I just want to let you know that 50% of my staff are working from home. They're rotating coming in to to the office, and we want minimal traffic as much as possible. I want to thank the Public Health Department for fitting my staff, adult protection workers and my child protection workers, with the N95 mask. We don't have waivers for child protection workers who have to go out on a child abuse call or an adult protection call. So I just want to thank the Public Health Department for helping us with that issue. And I want to say thank you to my staff who have been working very hard and diligently and doing the best that they can, considering the circumstances that are going on. This brings each one of us a unique set of challenges, and I am very proud of my staff and how they're all working together and leaning on each other and making suggestions left and right. So I just wanted the commissioners and you all to know that we're doing the best we can given what we are mandated to do. My child protection workers are mandated by law to go out and visit a child if there's a report of abuse or neglect. They're also mandated with child welfare to go out and visit kids who are in foster care, having a face-to-face contact with that foster child. My concern is last week, Job Services, Job Corps, I think you all know about Job Corps. We had an adolescent who enrolled in Job Corps. He was in our custody, physical and legal custody. We took him to Job Corps. Last week, Job Corps closed down the facility and put him on a bus coming back to Cortez saying, he's yours, we closed down our facility. Now we had to scramble, my ongoing workers had to scramble for placement for that 17-year-old. There was no family available. Luckily, we had a foster home who took him in. That normally doesn't happen with adolescents in our community. I'm very concerned with the shortage of placements that we have in rural Colorado in general. That most often we have to place children out of our county, which is unfortunate. Last night I received an email message from a shelter saying that we need to look for another placement for a 12-year-old who is placed there because they may be closing down because they have limited staff, and they will decide, if need be, to close down their shelter if there's a safety risk to their staff or any of their children. They may also close public access for people to visit in their shelters. So I am very concerned when we're going to get inundated with calls saying, find placements for these children, and we don't have them in rural Colorado or anywhere else. And when you see a service like Recovery Center who is closed and can't provide testing for our clients, they're going to open it back up, my understanding, on March 27th. We have court-ordered testing for those parents who are substance abusers. They're not getting tested. So there's a triple effect of everything that's going on with COVID-19, and I just want you all to be aware that we are having some major struggles with all of this, even today. And I know that probably it'll get worse, but we have to prepare for the worst, and we have to look for placements outside our community. I would also really look at using faith-based services if we need to shelter kids. If it came to that, maybe we need to look at the local shelter to do that. I don't know what's going to happen, because at one point, I think it was in the fall where we had to place a kid in our building, which was unfortunate because we had staff who was providing coverage 24/7 in our offices, which should not happen ever happen. And this was before COVID-19.
All right.
So I'm very concerned with
Hold on,
the
Jim.
placements and the facilities. I'm concerned about the children that we have
Okay.
that were mandated to see. So I just wanted to throw that out.
Okay, thank you, Gina.
All right, let us get a word in edgewise.
Can you hear Commissioner Sukla?
Not at all.
Can you hear me?
You get IT to, so it seems like all favor mics are dead.
Can you hear me?
It sounds
Dana?
muddled.
Well, the problem is they're hearing on Zoom through my computer.
Yeah, that's the problem.
I think
You're too
that's
close
the
together.
issue that we're having. So,
Well, ask Gina if she would contact Lori at the shelter and see if there can't be some arrangement made. We've got a perfectly good bridge shelter, which is exactly what it's set up to do, is to shelter people, and see if there can't be something maybe arranged with the bridge to shelter.
so Gina,
canopy.
can you contact Lori at the bridge and see what arrangements
We've
could
got a
be
big investment
made
in
with that shelter?
That's on my agenda because that memo came to me last night, and the first thought I had was, what about our own local shelter? If we
Exactly.
needed to shelter kids, even if we had to have staff do 24/7, because we do have to care for these kids. They have to be under our watch.
And tell
So-
her, tell Gina to please remind Lori, we have a large investment in that bridge shelter.
And Commissioner Ertel suggests that you tell, to remind Lori of the investment that the county made in that shelter.
My question to Gina is, what are we anticipating as far as
And Commissioner
that are gonna
Candelaria would
have to
like to
utilize.
know what type of number you may be anticipating.
I'll have to get that number to you, and I'll send it out on an email once I get the number. But I know two kids in particular. We have a child who's placed in a residential childcare facility in Arkansas. And my fear is that they could do the same thing, saying, we're closing down, and here's your child, we're flying him back to, or we're going to make sure that he goes back to Montezuma County, and then we don't have a placement for him. So I think we just have to be prepared for those kinds of
Let's
situations,
get prepared.
and I'm
Get
very
prepared.
concerned.
Okay, get prepared, and let us know what we need to do to help you in getting prepared. The next document
I have one more item, EBT
Okay,
cards.
make it quick, Gina.
Okay, go ahead, Gina, quickly.
I'm just going to give you all an update on electronic benefits transfer cards. Those are cards that are given to folks who are on benefits. We are now mailing those out to our clients. So I just wanted to make sure that you all know, in case you got calls from anyone, those are being mailed out. They're mailed out as soon as we get them, when they're ready to be mailed out. My assistant director, Luann, is going over to the post office and making sure that they get mailed out at the post office before 12 o'clock. So they should get their EBT cards by the next day.
All right, thank you, Gina.
And then, thank you, Gina. And the next document I have, and I don't even know that the people that requested it are watching today, but we'll just assume that they might be. Lisa Henry had asked about what progress social services is making. So I shared the document. Can you see your CSTAT dashboard?
Oh, yes, I can. I can see it on the dashboard, and I can see it in front of me as well. I can give you a review, a high-level review of the CSTAT scores that we have, but you have to take into consideration that some of these are going to be in the gray, meaning that we didn't meet our score. If you see the red line in the center that goes with those measurements, there's a red little line. That means when transformation of CBMS was going on, you could see our scores were going down more. And so HITPUF, Healthcare Policy and Financing, aren't looking at those scores as much because HITPUF was down and we were backlogged. So if you look at the first one, Adult of New Financial Applications, that's basically for old age pension, TANF, and what's the other, home care allowance. We're at 100%. And I can tell you that we kept on track, even though we had CBMS transformation, we were working very hard in that area for adult financials. And that's a good thing. In terms of the redeterminations, those are redeterms that are done every 6 months. You have to redetermine a client whether or not they're eligible. Those went down. Those were not actually our priority, but you will see we have an 81% at the end of that line. Our goal is 95%. And to look at an 81% during that time, that's actually really good. I can go on this line if you want me to keep going. It's going to take some time because I have some other stats to show you as well.
Let's go to the next item.
And probably the community should know that our most vulnerable population is basically our elderly and our children who are abused and neglected when we receive reports. So if you don't mind going to the second page.
Okay, let's just do a high-level overview of this one.
Okay, high-level overview. So you'll see for safety, if you go on the second page, Shaq, you're on the first page still? Okay, you got the second page, right?
I believe so. This is the second page of the same document.
It says
Okay, the
safety.
second page, you'll see APS, that's Adult Protection Safety. We are 100%, meaning that we have initial responses to new reports at 100%. We're making the deadline, meaning that 8 out of 8, like if you see for April of 2019, 8 out of 8 initial responses were done on time. There's certain measurements in terms of done on time. If you go to the next page, Shaq, timeliness of initial responses to new reports of adult protective
Wait just a second,
services
Gina,
is
so we
the
can
next
see the
page I
second
gave you.
page.
Hang on, Gina, I'm
So
trying
we
to
can
bring up
see
the
the
next
document
page.
as well.
The next one I have is timelines of initial response. Is that the one that you want, Gina?
Timeliness of initial responses to new reports, adult protective services.
That's the one I have up now, yes, go ahead.
Okay, so I want to give kudos to my adult protection staff. They're at 100% all along, all the line across. You can see they're making 100% basically. So I just want you to know that the numerator means the timely responses is based on the assigned response time, which is either emergency, 24-hour, non-emergency, or 3 business days. And the denominator means number of responses. So we can go on to the next slide.
So basically, as we look at this next slide, it gives our scores from February of 2019 to January of 2020, and then compares us to other small counties. And it says that we hit 100% and that we're doing as well or better than 91% of the counties?
Yes, that's correct. So they compared us to all the other small counties, and they did a percentage of how well other counties are doing and how we're compared to that. So I just want you to look at that report very quickly, and we can move on to the next one.
Okay,
Good
I'll
job,
move on
Gina.
to the next one. Commissioner Sukla congratulated you, said good job on those numbers.
I want to congratulate my adult protection staff. I have two adult protection staff and 1 screener, and thanks to you all, when I got the screener, this helped a lot in their caseload, having the extra manpower in doing the screening.
All right.
So we can go on to page 36. We don't have to look at this, but you can see how the percentages for Montezuma are 100%. And that is an excellent score for us.
Great.
Where that's attending to those adults who are self-neglecting, who are abused in some way or fashion, or they may have been exploited financially by family members or other members. So it's important that we serve our adults as well in this area for adult protection.
Okay, sounds good. And the next slide we have, Gina, is percent of cases with safety improvement, adult protection.
Okay, we can go, let's go on to the next one. Let's keep going, because I think the commissioners can see where we are at 100%. I don't want to spend a whole lot of time on CSTAT because it's not really appropriate at this time, but I think to get a general overview of what I as a director look at, I look at trends and patterns, and that's important why we have CSTAT. If you see something, a score goal is not as high as it should be, then we need to look at that specific case. What did we need? What did we didn't? What needed to happen? It's kind of like lessons learned. How do we learn from this? And I really appreciate these CSAT scores because a long time ago we didn't have such mechanisms to look at what our cases look like, what our caseloads look like. So this is very helpful. If you look at the timeliness of initial responses to abuse and neglect assessment, you're going to see some dips here. So if you go to the next page, Shaq, if you don't mind.
I'm at the bottom. I'm at page 40. What page do you want to be on?
40, that's correct. That one right there. If you look at December 2018, we were at 84%. If you look at November 2019, we were hitting 94. Overall, if you look at the initial response and timeliness to those referrals that we either get a 3-day, 5-day, or immediate response to those referrals for children are abused and neglected. If you see the small counties, if you take their overall percentage at the very bottom, you'll see 88.2%. November, we were at 92%. So you can see we are, at this point, working with Colorado Department of Human Services to get our scores up higher. We want to be at a high score.
It
We
looks
wanna
like
be
you've
at
done a good job,
90%.
Gina. It looks like from December of 2018 till November of this last year, you've improved child protection statistically 10%.
That's correct. You're seeing that correct. And that's what I want to see because in terms of practice, we have to be timely. We have to be timely with our safety assessments. Our safety assessments have to be done within 2 weeks. They can't wait 4 weeks. The workers have to do them. So it's a matter of teaching our workers time management and what they're doing and entry into the Trails data system. As you all know, we have Trails Modernization, which is a different platform, which is web-based. They have to learn that as well. So we're looking at 2 systems. We have Trails Legacy, we have Trails Modernization. And Trails Modernization has a different look and feel, and it's a different training that they have to be retrained in how to put those entries into the data system for child welfare assessments. So you're looking at new training. You're also looking at high turnover staff in child protection. I'm looking at all the factors that lead to the percentages that we have. You know, yes, we can improve. Yes, they are improving. And I believe that our child protection staff are learning to do better time management, are learning to do timely entries into our child abuse and neglect system.
Well, thank you, Gina. That's come a long way, and I think for those that are watching this on YouTube, seeing a 10% improvement in the child protection, especially after things that came out last year about the ombudsman, will go a long way. So thank you for the work that you've done to bring that along. Shout out to Chris and Roger and everybody on the child protection staff that's making that happen. Do the commissioners have any other questions for Gina?
No, just the percentage increase is great. Thank you.
They all say congratulations on the percentage increase. Gina,
Well, I just want to say thank you and a shout out to my child protection unit and the supervisors as well. This, you know, they're working very hard with the state, going through training, going through best practices and learning new skills, etc. It's been very challenging, and I want to thank everybody on my staff for putting that effort into what they're doing. It's to me, they're the unsung heroes that we have who have to do what they do, and I really appreciate all of them.
All right, thank you, Gina. We appreciate
thank you
that.
very much, Gina.
Thank you.
We appreciate it. Keep up the good work.
So we'll go now to our Veterans Services, Rick Torres. Rick, can you hear me?
Rick, can you hear
No,
Commissioner
because it's going through
Sukla?
his computer.
Yes, I am here, Commissioners. Good morning. Hello, everyone.
Good morning, Rick.
Morning.
Good morning.
Shaq, you should have my report for the month of February.
That's correct. I've got so many programs running that it's taking a second to get up
Okay.
there. But I'm sharing the documents. Are you able to see the documents, Rick?
Yes, sir.
Okay, and I believe that the document that I have in front of you now is the one that you need to get approved by the commissioners?
That's correct.
I would like to move that our Montezuma County Veterans Service Officers Monthly Report and Certification of Pay for the month of February 2020 be approved.
Second.
Motion and a second to approve the Colorado Department of Military Veterans Affairs certification of pay for the month of February 2020 for Montezuma County. All those in favor?
Aye.
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 They barely voted unanimously to approve that, Rick. Kim
Thank
will
you.
get you a signed copy. After it's signed, she'll email that to you. Will that work?
Excellent. Thank you, sir.
Thank you.
Thank you.
Okay, they're in the process of signing that now, and I'm going to switch over to your other document.
Okay, in the interest of time, what you see up on the screen on the monitor is our monthly report for our activities for the month of February. That would be our previous month. As you can see, I always like to compare the year prior. So in February of 2019, our office assisted 211 veterans and/or their survivors. When I look at February last month, you look and we see we dropped about 14 clients came through our office. We had a total of 197 veterans and/or their survivors. 23 of those 197 were new clients to our office. Last month, before everything got crazy with this virus, we were able to conduct in February 11 house call or nursing home visits combined. We did 5 outreach events, 4 community events. We did file 27 claims for VA benefits. We were notified that 9 claims were approved during the month of February. Those are claims that were submitted more than likely last year. All of them were favorable. There were no denials, so we're happy with that.
Good job.
I'd like to share with you our monthly income for the month of February. And what you're looking there is the 9 individuals that won claims combined. Their total income is going to be $10,447 a month. During a 12-month period, that would equal to $125,366 in a year. And those 9 individuals that won claims in February were paid $29,448 collectively if I combined all of their back pay together. When you look at so far to year to date, January and February of 2020, all the claims that we've been granted by the VA, all our clients combined bring in $19,559 a month. In a year, that should equal $234,714. And so far this year, everybody that's been paid back pay, a little over $71,000. So we're really excited about that. Are there any questions on our statistics so far for last month or year to date?
I have none.
Not on that. I have a question about something else, but go ahead.
So they didn't have any questions on that. Commissioner Sukla said he does have a question on something else.
Okay.
That question is how is it working for our vets to get in to see their doctors and hospital procedures?
He asked, how is it working for our veterans during this time to get in to see their doctors and hospital to have their procedures?
Sure, I can answer that now. The VA clinics are not seeing patients in person. What they're doing is they're doing telehealth through the phone right now. They're trying to set it up where they can do sort of what we're doing here now, which would be the Zoom or Skype with their doctors. So they're not physically seeing the patients. They're sending them, if they have an acute situation, they'll have to go to an ER. But they are seeing patients over the phone and prepping to do it through video live chat. I found out from an employee down in Albuquerque VA Hospital when I talked to her the other day. She told me that they had shut down their doors and they weren't letting patients into the hospital. So yeah, it has affected VA healthcare in that respect, one-on-one with doctors.
All right.
And I do have updates for you on what we're doing here in our office with veterans regarding COVID-19. I can go over that now, or I can do the 2 final points on my
Why don't you do your 2 final points, Rick, and then tell us what your office is doing so the public is aware.
Okay, great. I did want to inform the commissioners that late last year I started engaging with a local non-for-profit out of Memphis. They're called Speech Hearing Balance Institute, and they approached me because they do work overseas, particularly in Mexico, South America, with low-income individuals, people without access to hearing services, audiology services. So what they realize is there's a lot of veterans overseas, and there's nobody helping them with their claims. So we went ahead and started a pilot program where we're able to, they do most of the legwork for me overseas, and then they prepare the claims, they come to my office, and then I follow through once they're handed off to me from veterans that are down in Mexico so far. So far, January and February, we've done 4. I call them international claims because that's what the VA considers them. So we're processing and monitoring 4 claims from veterans that are overseas, or should I say south of the border in this case. So we're really excited about that. And one thing,
Commissioner Ortel has a question.
Sure.
Are these Montezuma County resident veterans that are living in Mexico now, or how are we tying up international with?
He wants to know if these are Montezuma County resident veterans that are now residing in Mexico.
No, they're not Montezuma County veterans. They're 2 of them, I think, are from Texas. 1 is from Washington State. But these are folks that are down there in Mexico that really it's difficult to engage the VA on their own. I mean, theoretically, they could reach out to their state agencies for help. So I do encourage them to do that, to locate their state veteran service offices. But in the interim, while this nonprofit that's working with them, I told them that in the interim I would take them, and we'll see how it goes. If I get overwhelmed, then I will definitely push them to their state agencies. But so far, they're doing all the prep work, and I'm just a funnel before it goes to the VA.
Okay. I just didn't want him taken away from his time and our resources for our county veterans.
They just wanted to make sure that you weren't losing any of your time or resources for veterans that reside in this county, but they seem satisfied.
No, that's perfectly understandable.
All right, what do you have next, Rick?
Okay, Rick, go ahead and tell us what you're doing to reach out to veterans while this COVID-19 is a situation.
Sure, certainly. Some of the things that we're doing here in our office, it has changed a little bit, quite significantly. I've encouraged our clients, both veterans and spouses, to stay home, especially if they have or start to have some symptoms, flu-like symptoms or illnesses. Last week, I noticed a big decrease in our activity of folks coming into our office and an increase in phone call, email activity. So it's kind of a good thing that folks are hunkering down and seeing how this plays out. So I'm fully on board with the clients staying home and working with us via phone, email, Facebook, encrypted emails, and Skype. So we are doing that. We are encouraging these virtual visits with our local organizations, American Legion, DAV, VFW, and they're also helping to get the word out as well as Facebook. The few clients that we have had come into our office since particularly last week, after somebody does come into the office, we conduct a wipe down of all the surfaces, the chairs, the desks, pens, styluses, anything that anybody comes into contact with. And as you can imagine, there's no more handshaking. There's not even any fist bumping going on.
We can imagine.
So, but that's okay. And the last thing I did want to let the commissioners know, because we did see a decrease in the number of visitors coming into our office. One of the things that we've done is we implemented a phone wellness check system. We began last Thursday afternoon. And what we're doing is Sarah, my assistant Sarah and John and I, we're calling our World War II and Korean War veterans and their surviving spouses. So we have our spreadsheets from our Colorado database. We make phone calls. We always are aware that because of their age, some may have passed away. So we do engage their family members. We express our condolences. But we have made contact so far with 128 of 229, so a little more than 50%, with either veteran, surviving spouse, or the child of a veteran or surviving spouse. Some of the things that we have found is veterans, one in particular was worried about prescription drugs. So when that happens, we give them the resources that they need, and then we call back within 24 to 48 hours. In this particular case, the veteran did get the medications that he was waiting for. In a second case, we had a surviving spouse that was waiting to hear from her daughter. We made a note of it. We waited a couple of days, called her back, and the daughter had already checked in with her. And what we're trying to do there is just make sure people don't fall through the cracks, that there's somebody, touching base with them. And if there is an issue, either my office will initiate action to go out and get it done for the veteran or the surviving spouse, or we engage the VFW, the DAV, and Project Outreach here in town, and the American Legion, and then we marshal resources to get the veteran or that surviving spouse what they need so that they're not struggling at this time.
Good job, Rick.
It's been very fulfilling. At first, they're a little bit apprehensive to talk to us. We explain who we are. After a couple of seconds, they remember who we are, and then we engage, and we make notes, and then we follow up if needed. Do you have any questions?
Good job, Rick. Just real quickly, for those who might be listening out in YouTube land, if somebody wants to contact you on the website, they just go to montezumacounty.org, Departments, Veteran Services, and contact you through that?
Yes, they can find us on the county's website. They can find us on Facebook. I can Skype with individuals if they have that capability. We'll do phone, faxing, emails, encrypted email if there's protected health information and Social Security and banking data. So yeah, we are still engaging our clients, and we're still here to serve.
Thank you. We really
Thank you.
appreciate it.
All the commissioners say thank you, and
I think that's the other real message, is that we are here to serve.
And-
We
and-
are
and-
open for business, and thank you, Rick, I appreciate it.
yeah, Commissioner Candelaria says thank you for being open for business, and he wants everybody to know that we are open for business.
Yes, we are. Let people know we're still in the fight.
All right. You have a great day and continue on.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Right, we'll go next to Gregory Felson, our CSU Extension Agent.
Wonderful. Good morning. Can everyone hear me?
Yep.
Yes, sir.
Yes,
Good
we
morning.
can hear you.
Wonderful. I just wanted to give you a quick update of the Montezuma County Extension Office as we respond to the COVID-19 virus. We got a directive down last week that CSU and CSU Extension would be working remotely starting yesterday. With that, we have 3 out of 4 of us in the office that are working remotely. Kathy, our office manager, is still at the office daily. What we have done since that time so that we can do as much as possible to be open for business to the public is we have bought and established our own Zoom account, and we tried it with Shaq yesterday and worked fine for us. We are also utilizing Microsoft Teams, which is a great platform to share documents and collaborate within our own network to develop virtual programming for the future. And that's mostly what I wanted to talk about is our virtual programming going forward. So all of our Colorado Master Gardeners programs for the remainder of their season will all be online. Tom Hooten will also be establishing Zoom video conferences with our Montezuma County Master Gardeners to make sure that program still goes on successfully. Andrea Jeter has been doing amazing work sending out with our 4-H program to all our 4-H families a survey, making sure that we know if they do have computer access, if they have the ability to reach us on a video conference link with audio. And so starting as early as next week, we are going to have first just an open Zoom forum for all our 4-H families and members. And then starting Tuesday, we'll keep up with doing what's called a 4-H 201, which notifies all of our new families, but also anybody within 4-H information around 4-H general projects, or moving on then into 4-H livestock projects, and then preparations, hopefully, for county fair this summer. We'll also do programming in what's called MQA, or Meat Quality Assurance, for all our livestock members, so that they are getting the information they need for proper food handling and the best animal husbandry skills. We'll be doing 4-H STEM activities during the day. And so a variety of different activities that we're just trying to get organized on, but delivering that, like I said, mostly via maybe a YouTube site that they get to watch it, record it, and then we'll have a follow-up Q&A on our Zoom account. Also a big thing, especially in our region, is definitely youth mental health. And so definitely checking in with youth across not only our county, but our region, making sure that this social isolation time doesn't lead to adverse effects with mental health. This Zoom area will allow for 4-H clubs to host their club meetings virtually as well too during this time. Two other things that I wanted to talk about with hosting meetings. Thursday, I'll be helping facilitate and host just the core group of Cortez Farmers Market, and so that they are getting prepared with all these new changes, knowing what small business loans are out there, what other resources is out there from the USDA end, all the way from the state and our local ends as well too. I made a note also to follow up with Laurie after this meeting, because food producers are organizing right now with our family ranchers and farmers, of getting together and organizing meetings so that we are developing that resource for producers, so that consumers then can look up virtually and get in contact directly to farmers and ranchers. And so working collaboratively with a lot of the Mancos Valley farmers.
Hey, Keenan, Commissioner Tell says, good job.
With getting in touch with Laurie Hall.
Great.
And food
And so I want to work with Laurie to see, like, with the share house, of what that really looks like, of if they can find some money, what that works out of putting money in farmers and ranchers' hand at the prices that will keep those family farmers and ranchers afloat during these times, because I know those are big concerns. However, we're working on it onto those ends, and it'll probably, knowing our San Juan Basin, it'll be a regional approach onto that end. I look forward to updating you the next time to show you hopefully what we've created in sort of that producer to consumer direct link onto that end.
Good work.
And then lastly, before we all went on lockdown and all of that, I did face-to-face have a fair board meeting, and it was great to meet all the members of the fair board, and we worked on a final schedule to approve for this summer, and we're just crossing our fingers, staying positive, staying resilient, and but we'll keep moving with that. And once again, our Zoom link through the extension office, if we do need to go virtually for those meetings to keep running, we'll run them that way. But that's what I have right now. If you have any questions, please ask them now.
All right, Commissioners, any questions?
I have no questions, just a comment.
Commissioner Candelaria has a comment.
Thank you for getting with Laurie or putting that together so that can be coordinated.
He said thank you for getting together and coordinating with Laurie.
No, thank you all. Yeah, these are tough times, and look forward to collaborating with whoever possible the best way we can be needed.
All right, awesome. Thank you, Greg.
Thank you.
Have a good day.
Thank you. We'll go to Jonathan Parker, give us an update on the senior services. We've already had a little bit of discussion about that. And we'll
Okay,
see
John,
what
are you
else.
there? John?
I am here, Shaq. Commissioners, good morning.
Good morning.
Good morning.
Good morning.
Do you want me to go through this little thing I sent you last week, Shaq, or do you want me to address the meal situation, the frozen meal situation? How would you like me to proceed on this?
You just start with wherever you're comfortable.
Okay, so just some quick notes, then we can get to the meal situation that I had sent you on this is staff are remaining on site as necessary for most of the day because we do get walk-ins, we do get calls, and so we're trying to be here as much as we can. Just as for a note for that, we can do some data entry from home, and I have given staff that option to do data entry from their homes. They can log into the various systems that we use from their home. Volunteers, along with MoCo, that is Volunteer Community Connections, who has done a lot of our work for us, volunteer work, has also offered their staff assistance. Salvation Army has offered assistance. We've had several people willing to volunteer just from the community in general. I had a retired nurse yesterday give me a call offering her services. On that note, with volunteers, under the AAA guidelines, we're required to do background checks on volunteers, and that has been waived for now. So if it ever did come down to the situation where we just have to find volunteers, that's been waived if we needed it. Right now, I don't see a shortage of volunteers. Again, depending on how big the situation gets, we may need more. The health department, of course, is delivering some meals. Food, there's no disruptions with our food suppliers, either Shamrock or Ben & Keith. We haven't heard of any across the state, and we stay in touch with the state nutrition people, and there doesn't appear to be any across the state that we've heard from. All meals now are home delivered. And I would just note when we did do a pickup or delivery option, that was basically in line with what other sites in the AAA had offered to us. We never had any congregation of people. I did not allow more than 3 people inside the facility to pick up their meals, and I actually kept them about 15 feet apart, and then we just rotated for them to pick up their meals one at a time. So there was never any group of more than 3 and none closer than about 10 to 15 feet apart. So we did practice that before going to full home delivery. Of course, all the activities are shuttered. There's no games, no activities. We have put out puzzles, books, activity games. If the senior wants to come by and pick up some puzzles or a book, we have quite a lot of stuff out there for them. We encourage them early on to take it home with them, and that's mostly what they have done. We haven't had any people come by to pick them up since we've gone to home delivery only. One other exception on the home delivery that is kind of important for drivers. One of the requirements for home delivered meals is that it actually has to be a handoff. So the meal from the delivery to the recipient has to be directly to that person. That also has been waived, and we're allowed to put it into a plastic grocery bag, knock on the door, and hang it on the door handle. So that's actually a plus. Although most of our recipients who get meals at home tend not to go out, but that's a little more comforting for the drivers. Today we have 8 new clients that have come in from long-term options and full home delivered meals. They typically, under our AAA guidelines, they have to be what's considered homebound to receive a home delivered meal, but that criteria too has been waived, and we're creating a new category, what's called COVID-19 meal recipients for reimbursement purposes, so working with the state and AAA. So So some of those guidelines or rules that have been in place for people to get meals have lessened or been waived. So we're good on that front. With regard to the meal situation, when we went to the home delivered meal only situation, we lost about half of our regular participants in meals. So I think 12 or 13 have stayed on to get a meal at home. And then with the 8 additional from long-term options. Now, it is true that we do meals Monday, Wednesday, Thursday, and what I'm saying applies to all of our sites, Dolores and Mancus as well.
Hey, John, can you tell us why you think you saw the initial reduction?
From what they told me, and I kind of did this in steps, Shaq, what I did was early in the month, we talked to them a lot. Of course, there's a lot of angst in general, just in tension in society. And, I kind of wanted to take this in steps and keep them ahead. And so we kind of started with, if you're feeling uncomfortable, you don't want to come do a pickup meal. This goes back into the 2nd or 3rd of the month. And then as things kind of progressed, we just kind of kept them in touch. They are a real social group. They come here to be together. They come here to meet with their friends, hang out, play activities, and play games. And most of them are, since they're not considered a homebound person, they actually have the ability to cook or get food. And we're not seeing, I know some of the shelves are lower in foods at the stores, but there's still plenty of food in general in the community, in the stores. And they would rather, if that's going to be the situation, stay at home and cook the meal than come here. It was kind of an odd feeling, honestly, to have our participants, 10 feet apart, sitting inside just for a few minutes while they sign up for their meal, sign up for the next meal they're going to get as a pickup, take it. And then when we went to full home delivery where they were required to, I just think that was just, they're losing out on why they really come here. So I think that was the reason. And that's what I heard from them.
So thank you, John. So my understanding then is that if they're not coming to socialize, they'll just cook for themselves. Is there any precautions that we may or may not have been able to offer as far as helping them to shop without having to go out as much, since they're part of the vulnerable community? Have we been able to share with them the messaging about when the stores are providing the senior shopping hours?
I have not yet on the senior shopping hours, but we did let them know. Every day we met with them at lunch and gave a little talk and update with them, and did inform them that we're here for them. Should they need anything, we're more than glad to do it for them. So we put that out both in print. We've hung it on the door. We told them in person. I have not yet got the message out about the senior shopping hours, but we can include that in a little flyer for the meal that goes out home delivered. We can post those or put those hours on a little sheet and a little flyer and send it out, and we'll put that in the newsletter. Of course, this newsletter will be brief this month, but it's basically going to contain that type of information for them.
That'd be great. Thank you, John.
Yeah, we need to get that out. Maybe we can get that out to our PIO too as well.
And would you get that information to our PIO too, and we will get it on the radio and in the newspaper and everywhere else it needs to be?
Yep. I'll put it online too on the site. I got to change what's on the site as well.
Okay, and I think Commissioner Candelaria has a statement or a question.
So, John, you did order that pallet of the 25 cases of 1,050 mils, is that correct?
You ordered the pallet of the 15 of the what, Commissioner?
There are 1,050 mils in a pallet.
The 1,050 meals on the pallet, you did get that ordered, correct?
Well, they're packed. I just need you to look at that agreement check and have it signed and then get it back to the guy. But everything, they packaged the meals last night, and I think when I talked to the representative, they're ready to ship. I didn't sign that agreement because I wanted it to go through you first.
Yeah, also.
So I sent it to you this morning, Jack.
You sent it this morning. Okay, I'll sign it when we're done with this meeting, and I'll get it.
So does he need the approval for the 6352?
Yeah.
Prior to that, or Or is that within,
Well, if he does, let's just approve it.
that's what I'm saying, are they, because it says on this email that those are unbudgeted funds, is that correct?
Well, that's correct. We wouldn't normally be doing this, but I think when something like this comes up, I don't think we need to go through all the red tape. Let's just approve it and go.
And let me add to that too, Shaq. The cost has actually come down a little bit, and rather than doing the 25 boxes, what we've done is it's going to be 200 boxes. Each box will contain 1 week or 7-day meals. So, and we have it. We are authorized or approved for 400 boxes. So 200 boxes in this first shipment. That's 200 potential clients to get a week of meals, or 100 clients for 2 weeks, or 50 clients for a month. And then in 2 weeks, we'll be able to double that to 200 more. So people have a full box for 1 week of meals. So if there's the concern of 7-day meals, that's what this will cover. The cost is coming down because yesterday, with the Department of Justice putting some kind of conditions on the price gouging for shipping in particular, shipping was kind of high. So we have seen a little reduction where I talked to the sales rep. The cost might be a little bit less than what's in that agreement. So the agreement is 200 for this first shipment, 200 boxes, 1 week a meal per box, and then in 2 weeks an additional 200 boxes should we need it or need more.
Oh, okay. Commissioner Ertel has something to interject.
Yes, ask Jonathan, if we approve this amount of money, is there not the possibility that through AAA, through our AAA and Christina Knoll and Durango, that we may not be able to get reimbursed for some of these extra meal costs that we're being confronted with?
Is there the possibility that once we approve this money, some of this may not be reimbursable through AAA?
So I asked that question to Christina, and I just got the email from her. My hunch is, Commissioner, that probably, I don't want to say 100%, but my guess is, so there's approximately $117,000 available for Region 9. If you take this 8,400 times 2, you're about $17,000. That's, 20%, less than 20%. And I guess what I would say is, I think that probably close to all of it would get reimbursed. I don't want to say for certain, but here's her response. The relief funds are earmarked for meals under the COVID-19 crisis. I'm not sure how much your order will total, but you can count on AAA to help pay for those meals. And I had informed her I was going to be meeting with, the commissioners this morning and was hoping for an answer. So I just got this a few minutes ago. So my hunch is, Commissioner, that a big portion, if not all of it, would be reimbursed under this COVID emergency relief funding.
They're glad to hear that.
I am too.
Then I think we should go ahead and approve the amount.
I mean, and this simplifies a lot too, Shaq, because as I had mentioned, our staff, I mean, we do have capacity to cook more meals.
Okay, good. The commissioners are going to vote if you'll hang on just 1 second. I think it's going to be a very tight vote, but we'll see how it goes.
Probably going to be.
So I would move that I'm going to use the number I have on my email here of $6352.50 for the additional meals for the senior center.
Second.
There's been a motion and a second to approve the amount of $6,352.50 for the increase in meals for our senior center. All those in favor of Montezuma County?
Aye.
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 Boy, it barely passed, but it was 3-0.
2-1.
Sweating bullets there. I appreciate you guys a lot. I know I can't imagine on your end what it's like. So I would just say from our end, we appreciate the county folks.
All right, well, thank you, Jonathan. And
Thank
keep
you,
up the good
Jonathan.
work.
Jonathan.
Okay, they all said good job.
We're looking for a productive
appreciate
meeting
it.
tomorrow with,
All right.
Yes.
okay, anything else for the good of the order?
Okay.
MoCo update. Jennifer, are you on the phone? For
Jennifer,
our
can you hear us now?
transportation Needs.
Jennifer Morris? Let me try to find her on here because I believe.
There we go. Can you hear me now?
Yep, we can hear you. Go for it.
Okay, I thought I unmuted. So just a few things, kind of touching on what John had said. AAA has given us some more money. They have also told me that I can, under the COVID-19 structure that they're doing, any of the meals that we deliver can be done or can be claimed as a ride.
Yeah.
So that's a good thing.
Good deal.
Yeah, because our riders, like Jim was saying, we're pretty low on riders. The MOB, the medical building, has decided to do mostly phone calls to their patients. So we had a lot of people call and cancel their rides for the doctor. So that's going to hurt us a little bit too. We've lost so far CCI, Opinion Project, nursing homes, and then the MOB at this point. Let's see, we did help with the home delivered meals yesterday. I gave them 3 drivers. One was for the health department and their meals that they're wanting to get out, and then 2 for the senior center. Like I said, we get paid for those, so we might as well utilize our drivers. Keeps them busy.
So Keenan has a comment.
I want those health department meals to be done through our seniors. I think I'm not sure how that got started, where our health department is now delivering home delivered meals to our population, but I want to see that
So
get
Keenan
drawn
is saying
back
that
into
he
our-
wants the health department meals to be coordinated and to go through the same as the senior service meals.
Okay, that's fine. And like I said, if they need us, we're here and we get paid for driving for that. So,
Absolutely.
so that we're available for that. I have a driver that has backed off of wanting to drive people around. So that's one of the things that she is here for if we need her, is to drive just for the Meals on Wheels. And then I also have an older gentleman that is a driver that is over 70. And if we get a case here in Cortez, he wants to back off driving as well. And I can understand that. So that's kind of what's going on with that. Obviously, we haven't had our first case yet, so that's wonderful. The state has seen a lot of transportation closures, actually closing down. The senior center in Durango is no longer doing transportation. Montrose is no longer doing their senior transportation stuff. It's just, there's a lot of people that have. AAA and CDOT have told me that they are providing for, if we do shut down or we do have to reduce staff, that they are letting us still submit their pay. So they're going to still get paid whether or not they drive. So that's, I think, a good thing on this end, just in case we don't have, we can't keep them busy. Let's see. And then CDOT is also paying out at 80% operating instead of 50%, so that we can pay our employees if they're not working.
That's a good thing.
Yes.
Go ahead and tell us how else you're responding.
We are, so I looked it up and we're actually considered essential, so we don't have to do the 50% reduction. However, we kind of are doing a 50% reduction because we only have 2 to 3 drivers versus 4 to 5 normally every day. We are also in between every client wiping down the vehicles with Clorox wipes, sorry.
Commissioner Sukla has something to say.
Do you feel like that's adequate then, that we're okay with the amount of drivers that we need? Do we need to hire some more drivers, or?
Do you feel like you've got adequate driver staff at this time?
Oh, yes. Yeah, we're good right now. We're losing one next week, but she's going to come back in the fall. She has stuff she does in the summer. But no, we are fine on drivers. We don't need to hire anybody else right now. In fact, like I said, if right now we're just running 2 to 3 a day, so we're good there. And then we are also not allowing or not having anybody sit up close to the driver. Everybody has to sit back in the back of the vehicle, or far enough. The 6-foot rule is what we're going with. So they sit back behind, and then we're not letting them sit in the front passenger seat if there is one, just to keep our drivers safe. The other thing we're doing is if they have to get close to a client, like a wheelchair client that has to be buckled in, they're putting the mask on and gloves, and they're also giving that person a mask and kind of acting like we're just making sure that, if either one of them has something going on, that we don't transmit it. We're also not transporting anybody that is sick. So if they're sick, coughing, look sick, runny nose, that kind of thing, we're not transporting them.
Okay.
All right. Thank you.
Anything else, Jennifer?
No, I think that's it.
Okay, great. Thank you for the update.
Thank you.
You're welcome.
All right. That brings us back down. to the county attorney's report with John Baxter.
The one thing that we need to do today is, over the course of the last week, our chair, Commissioner Sukla, issued or signed the emergency declaration, and those are by law only good 7 days unless all three commissioners get together and agree, consent to ratify this and continue it. So if you all do agree to continue it, I don't think that any risk has subsided since Commissioner Sukla did that. All we really need is, I believe, a vote from you all to consent to extend the declaration indefinitely until you all determine that there is no emergency anymore.
Any discussion on that, commissioners?
No, I think
No,
that's
I
just
would-
protocol. Yeah.
I would move that we ratify the declaration that Commissioner Sukla has signed and extend it indefinitely.
Until further action by the board.
Until further action is required by the board.
Second.
Motion is second to approve to ratify the emergency declaration for Montezuma County indefinitely until further action is taken by the Board of Montezuma County Commissioners in the future. All those in favor?
Aye.
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 And we're still operating. You know, our office downstairs is pretty small anyway. Naomi is going to be there pretty much all the time. Ian McLaren and I are both already set up to work from anywhere from our computers. Most court, I didn't appear at all in court last week other than by phone. So in person, I haven't had to appear. I can't recall if Ian had to appear in person or not, but for the most part, the courts are really slowing down, and for essential hearings, for the most part, people are appearing remotely by phone. So that's really how our office is operating. We're still, nothing has really slowed down as far as having to meet deadlines, file pleadings. PAX is ongoing. We have discovery deadlines this week. Gordon Vaughn, who is our attorney that was recently assigned to help us once PAX filed an additional claim, insurance decided that they would now put an attorney on it with us, and he filed a motion to dismiss several claims. I think it was Friday of last week we got that filed. So it's nice to have him on board with us, helping us with that. I spoke with him yesterday, and again, we've got more deadlines coming up this week. Everything I think is still operating just from our computers instead of in person in court.
All right. Any issues then?
Nope.
Okay, thank you, John. We'll go to the Natural Resource Planning and Public Lands report from James Dietrich.
I texted him, and he'll be in here in just a second.
All right, well, then
Until
why don't we-
I guess I'll just
Well,
fill
one
in.
thing I can ask is, we had Mr. Haley, our planning director, sit on a phone meeting with the Ute tribe. Did we get an update from him? Do you know if he's
So
here?
he was trying to call in during this and saying he kept getting a busy signal, but I'll see if he ever got anything else.
Okay, why don't you do that? And we'll just keep going down the line. Commissioner Tell, do you have anything for?
Yeah, my only report is, last week I would have given this report, but we didn't have our meeting last week. I was at Club 20 for 2 days, Thursday and Friday, the week prior, and on their board of directors and doing their transportation, energy, and agriculture, and public lands and natural resources. Had 2 days of meetings there. They were very good. I think the Club 20 staff and the Club 20 direction is very, it was attended fairly well, but not as well as it could have been. But I've got the directives and what issues they've sat down on and decided to take stances and positions on, and so it was a good couple of day meetings in Grand Junction. So
And you think that the attendance may have been that way just because of the ongoing coronavirus scare,
I think
the
it must have started,
COVID-19?
yeah, it didn't quite start by the time of those meetings, but it was
was
in the.
getting ramped
It was
up.
on the horizon, yeah, it was on the horizon, and we had some people called away from them that left during the conference, so were there one day and then went home the next, were there Thursday and not there on Friday, so it was, it's a different meeting, so.
Oh, okay. Shaq, what did you find out from?
So Don Haley said all he could get was a busy signal. He believes that that was a go-to-meeting type number and that it's a different, it'll be a different number every day, or that the access code may be changing, but he couldn't get anything besides a busy signal.
Oh, okay.
And James Dietrich is on his way in now.
All right. We see James as we speak, so we'll let him come up and give his presentation.
Good
morning.
James.
What I have this morning is 2 letters.
Is that mic on? Do you know?
So I have 2 letters. One of them is a request for a closure for Mesa Verde National Park. And so I've contacted all 3 municipalities. We've got concurrence from all 3 municipalities. I have a signature from the city of Cortez and the town of Mancos. I expect to get a signature from the town of Dolores also here very soon. So at this point, we're just asking for the commissioners to sign this letter, if the commissioners concur. The situation at Mesa Verde has deteriorated. They have closed down all of their facilities up there, the museum, the lodging, restaurants, all of that. They're facing having the vault toilets being closed also, which leaves absolutely no facilities whatsoever for anybody to actually be able to use that park. It's essentially a dead park at this point. But to actually pull the trigger to have the gates closed at this time is what they need some assistance from us with. So that is the request of the commissioners, and I'm sure that I've talked with Cliff about it, and he is eager to reopen that park as soon as possible. We all understand what the economic ramifications are, but feel like it is probably a prudent measure at this point.
Any further discussion, commissioners?
No, I think everybody's in concurrence.
I read the letter. I guess my only thought is, this seems a little bit, I thought he had the authority to close the park. Like if there's a wildfire or something up there, don't they have the authority to close the park? Or do they not?
You know, I don't know the policy on that. It would appear that they had the ability to close it during a wildfire. For some reason, this is a little different.
Okay.
What he told me is that he visited with the park superintendent of Rocky Mountain National Park, which was closed. And what we understand is the only way that park was closed was by sending the letter to the Secretary of the Interior to request that. And it was the town that sent that letter, and the town of Estes Park essentially demanded the park to be closed. So, for some reason, superintendents have the inability to just randomly close the park. A wildfire or something like that, I don't know what the difference is. It doesn't appear to be a difference to me, but apparently there is.
But it's at his request because the park is basically shut down anyway at this point in time.
That's it, yes.
Okay.
Okay,
Anything else?
No, I would move that the Board of County Commissioners sign and adopt this letter to the Department of Interior recommending that Mesa Verde National Park be officially closed until further notice.
Second.
Motion and second to approve a letter to send to the Secretary of Interior on closing the Mesa Verde National Park, which resides in Montezuma County, until further notice, prudent to open back up because of lack of toilets, it's a dead park. So, all those in favor?
Aye.
Aye.
Well, I think lack of toilet paper is accurate because apparently
lack of facilities, yeah.
They apparently have had everybody up there raiding sanitizer and toilet paper, making off with it from every public restroom that was open. So.
Okay, what do you have next?
Okay, I also have comments on the Ricoh Trail project. We're in the EA, draft EA portion of this, and so at this point, we do need to submit a comment to retain our standing. I have done some outreach to the folks that are involved, San Juan Trail Riders in particular. I was a little skeptical that they were supportive of this trail project. However, indeed, they are supportive of it. And if you look at the map, it's pretty much a realignment of that Spring Creek Trail. So essentially, that connection will still be there. They're not really losing a lot, I think, is part of the reason this is acceptable to San Juan Trail Riders.
More realignment than...
That's really it. And we have a little bit of trail closure that they're talking about decommissioning, and it's that Stoner Creek Trail, and the Stoner Mesa Trail, and it's that portion that runs down to the private land. Now, I mentioned in the letter, we're uncomfortable with decommissioning trails, and that may be what they decide to do, and there may be some valid reasons for that, but I think it could be a public right-of-way. We don't know. We haven't done the research, and they haven't apparently either. So I just wanted to point that out to them, and we remain uncomfortable.
Keep that fresh on their mind, yeah.
Other than that, I think most of the other suggestions they've made through the proposed action seem to be pretty reasonable. Rio Grande Southern Trail, that'll create a multimodal connection to the Colorado Trail via Scotch Creek. And then the Circle Trail, there's a little controversy over that, but that seems like that's sort of ironed out, and that'll provide multimodal connectivity to the Colorado Trail from the other end of town. So, I think pretty much every one of these proposed actions seem to be pretty reasonable.
Commissioners, any discussion on the proposed
Need
letter?
to go up to the head of that, to the very first of the letter there. What is the Montezuma County BOCC County Commissioners? Shouldn't that be Board of?
Okay, I found that was just a typo.
Just a
Yeah,
typo.
yes,
Okay.
I've got that corrected.
I got you, okay. That's all I was worried about.
Commissioner Candelaria, anything?
No, I sent in my corrections also. No, I'm good with the letter.
Okay.
Anybody care to make a motion?
Shaq's moving it up and down so quick I can't.
So, in plans for my department.
Let's get this
sorry
letter
about
taken
that.
care of. Are you going to make that
So-
motion, Jim, or do you?
Yeah, so I would move that we accept and send the letter to Derek Padilla, District Ranger for the Ricoh Trails Project. EA.
Second.
Motion and a second to send a letter on comments from Montezuma County for the Ricoh Trails project. All those in favor?
Aye.
Aye.
Aye. Okay, continue.
Okay, so the plan for us in my department is I'll try to work remotely. It's working pretty well. I'm not set up quite as good as a lot of folks. I haven't really got a way to get images into my house. But again, I got a telephone and I got jump drive, so I'm getting along fine.
But I think, and we've had some discussion here amongst the commissioners this morning, there's plenty of separation, that distance separation in your office with anybody that might be in GIS or any of that. I think rather than you trying to struggle at home, I think you should come to your office and be in your office and be there working. I think we've got every latitude from what the governor said about our government being an essential service, that we have some latitude in how we run that, and I think if you're finding it difficult or not as convenient to work from home, I think you should be in your office. That's just my opinion.
No, and I'm okay with that also. I believe that it makes sense the way you're separated from everybody, that if it's more convenient for you to be in the office, there really is there's no action with the public for sure, and really shouldn't be any action with the rest of the staff. So
yeah, we're pretty isolated. So I'm
distancing,
comfortable
that
with
isolation is pretty much done.
Best for you.
Okay.
Sounds good. Okay with that, Shaq?
Yeah, what works best for you?
Okay, that sounds good. Well, I'll be in a lot more then.
All right.
Okay, so we've got a meeting, and of course all the meetings are kind of remote. We'll talk about the ANS situation up at the reservoir this afternoon. We've got a meeting organized on that, and we'll just kind of continue to kind of
Who's that meeting, is that a phone conference, like a Zoom meeting?
That's correct, yeah. So it'll be with the Forest Service, Dolores Water Conservancy, CPW, and there'll probably be a smattering of other folks in there also.
And then I guess, your report, are you going to talk about what you worked on for the
For the
CDOT?
MMOF?
Jeff?
Right.
Yes.
And I don't know if you got back with Matt Morrow, correct? But
yes.
basically do you want to do that, or do you want me to?
Oh, go ahead, go ahead.
On the 12th, we had our TPR meeting just before everything fell apart. We actually had a pretty big group meeting, and the ratification was done for our MMOF grant that we applied for in the tune of $510,000. We're going to be able to receive 90% of that, and it's 462, I believe.
Yeah, that's about right, yeah.
And no match. We will have to send a waiver letter, but other than that, it was ratified by that group on the 12th. So, and that will go to past the Mesa Verde. So.
And I've already sent a letter requesting the waiver, so, I mean, unless there's something new.
Nope.
Okay,
Nope.
then I think that's already been taken care of.
That's just fantastic.
Well, I'll tell you, that's good stuff, good stuff. Good on CDOT, good on you, Jim, good on you, James, good on all of you. That's a big boost to that project.
And to follow up with that a little bit, I've had the conversations with Matt Moraro and CDOT, and so we're talking about how we advance the design that we've got onto the Cortez side without having to go through a whole new selection process for an engineer. Now, one thing I do want to point out, and we've actually, it just sort of turned out, we've had the opportunity to try 2 different engineering firms through this process, because we started off with Loris and Associates, who were bought out by OTAC, which is a nationwide engineering firm. In the meantime, Peter Loris is retired, and so his portion of Loris is essentially completely been absorbed by OTAC. So we're under a whole new engineering firm. So anyway, we'll have an opportunity to try somebody new, and we still have some continuity because 2 of the individuals that have worked on our project are still employed by that engineering firm. But they do have a whole new philosophy, and we'll see if things turn out a little bit different. So what we'll try to do is make sure that those guys can continue their work on the Cortez side, and we've already re-engaged to, they had about $15,000 left in the account. And so we're talking, well, what do we do to spend this money out? Okay, well, let's get it going on the Cortez side. Let's pick something that we need to advance. LiDAR is something we need. So what they're trying to do is coordinate with the surveyor to make sure that we get all that background information so that once that money hits us, we can keep rolling with it. So,
great.
All right.
Stuff.
I think that's about all I've got for the day. So,
Well, thank you, James. Thank you. Your hard work, and we really appreciate everything you do for us.
Thank you.
Thank
okay,
you.
you're welcome, gentlemen. And again, I'm always available 24/7 by cell phone. So.
All right.
Thanks,
We'll-
thank you.
We'll go, actually, do you want to finish your report, Commissioner?
I can actually. So let's see. After that Thursday, actually flew to Denver. Was going to attend the CCI meeting, but everything started falling apart. Felt like it was more beneficial for me to get on the first plane out of there and get back into Montezuma County, which I did so. Met with Friday morning with the board of the Ag Show, and that's where obviously everybody knows that by now has been postponed until September. I was able to attend that meeting. And then Shaq and myself went in person and gave a Montezuma County address, the state of address, to the city of Cortez at a special meeting Thursday night, the 19th. That is live, that could be viewed. Basically a real quick update for all of the county people and the city and the municipalities of what we were doing and what is going on. And that should still be live, or not live, but able to be viewed. The rest of it's just been attending meetings by Zoom, and all of the meetings that were in person have been canceled. Or I don't want to use the word canceled, I want to use the word postponed, because I don't think anybody has canceled anything. Everything has just been postponed or delayed until we get through this situation that we're in.
All right, thank you, Commissioner. Or were you good?
That's all I have, yep. Yep, I'm good.
I have a quick update. I was at the meeting in Denver as well, Thursday and Friday. Well, came on the first plane with Commissioner Candelaria as well Friday morning. However, got to participate in the meeting via phone in time got back in time. Very healthy debate over the wolf introduction on public lands, for and against. If we use science, I think that the argument was very easy to solve. However, a lot of people are wanting to make a decision not based on science.
Based on
participated in a meeting yesterday with the Ute Mountain Tribe. They're having daily briefings, and they're keeping the county updated. They're participating, watching this meeting as well. And I think that relationship between the Board of Montezuma County Commissioners and the Ute Tribe is solid. We're all working together. We're all neighbors, friends, and we're all coming together as a community to so we can to move forward with our community in these times of trying times. So that's all that I have. We'll go to our county administrator, Shaq Powers.
Okay, I've got a bunch for you.
We figured you did.
I was gonna start by telling you a COVID-19 joke, but I figured I'd have to wait a couple of weeks to even see if you got it. So first of all, I want to thank all of our department that has been everybody's been having to flex a lot during this time, but especially our IT department has just really gone above and beyond, trying to equip people that can work remotely to work remotely, fix email glitches, do all of their regular duties, and then figuring out a way to make this possible. As you know, a lot of boards, a lot of councils are not meeting right now, and it's thanks to our IT department that we're able to do this today. And of course, you heard the great report outs from MoCo, everything that they're doing. The public health department has been working 7 days a week nonstop during this, and I think about every time they react to something, the governor or the CDC throws something else down the pipe, and they have to completely shift gears and change the plan again. So, and of course, our Office of Emergency Management, our new Jim Spratland just hit the ground running. So. He did not step into an easy time to take the job, so that's for sure. So I wanted to start with that. I emailed you late last night. Joyce got the February payables done. I don't know that you've had enough time to look that over and want to make a decision on that. If not, I'll just table that till next week, which I think is fair.
I would appreciate moving it till next week. You're right.
Okay, sounds good. And then I did ask the departments, I sent out an email just kind of to get a situational update on where they're at. We've heard from some of them today, so I will not repeat anything that they have, but I did ask, if they have the potential to reduce their staff, what does that look like? And what kind of, if we end up going long-term into this, what kind of funding cuts can their departments take if necessary? Let me blow this up so I can read the darn thing. I sent this to you pretty late last night too. But the landfill, starting today, their crew has gone to 510s. So that gives a little bit of spacing there from when people are coming in. For the most part, they are able to, keep people in their own equipment. There's not a lot of spacing needed there. We got an update from Social Services this morning. Obviously, during this time, they're not going to be able to cut any funding. They're going to be giving out more money.
Shaq, I know this is just preliminary, but I was wondering, can we have our finance director in here so we could, to ask questions?
Absolutely, I can bring her in.
Okay.
So Joyce and Phaedra will be able to alternate working remotely as needed, and we're kind of playing with that schedule on a week-by-week basis to see what that may look like, but we're always going to have somebody here. From the administration budget, it looks like short-term, we can at least cut travel expenses. And I'd say that's going to be fair for several departments as well. Planning department and GIS, they're willing to transfer their shifts. Basically, I think what they're going to do on that end is alternate who's here what day and who's working remotely. So on that end of the things. Doug said that they'd be able to reduce their travel budget by 75%, which I think that's easily accommodatable since nobody's able to travel right now. Anyway, makes common sense. The district attorney has most of their people working from home. They just have a couple of people in the office. John gave his.
Are they having any trials? Do you know?
There are trials, and from what I'm able to understand, the court is kind of giving conflicting guidance, and almost every judge is trying to do their own thing. Would you concur with that, John?
I don't know. I definitely think there's conflicting directives, and I believe the governor issued a directive saying to, or no, it wasn't the governor, I'm sorry, it was the Chief Justice of the Supreme Court issued a directive saying to continue any trial and not have any that is not a criminal trial up against speedy trial deadlines. My understanding is that perhaps some judges in different jurisdictions are continuing trials even if they are up against speedy trial deadlines. There have not been any jury trials, to answer your question. If they're continuing to have trials right now, there have not been any in the since these directives came down that I know of. But whether or not they're going to try to have them or not, I don't think that has been determined.
Okay, thank you.
So obviously IT is working a bunch of overtime right now. And for the treasurer, they're basically closed to the public, but they are working online. They're all going into work, and they're available by their regular phone numbers. The clerk's office, I could read all this, or we could just ask the clerk to explain it.
So basically what we did is we extended our hours. We're going to have half of the staff working Monday through Thursday, half a day Thursday, and then the rest of the staff's going to be working Thursday afternoon through Sunday. So everybody still gets their 35 hours. They don't lose any kind of benefits or pay. We're still going to be accessed by phone, by fax, by email, by our Dropbox. So we're going to be available for them to reach out to us, and nobody loses any kind of time.
So your office will go to being open 7 days a week, is that what I'm hearing?
No.
So
We're
that's a
not
real
open to
benefit.
the public, but we are open to work.
Okay.
So.
All right.
So what days will you be open to the public? Are there any days or just your normal Monday through Friday?
At this point, we're not open to the public at all.
Period, okay.
Yeah.
Okay.
That's statewide, I believe.
Yeah, it is statewide.
And then I believe the assessor's also following some statewide directives, but starting 3/24, which is today, they'll be working 7:30 to 6:30 with only 3 people in the office at a time, and that'll keep them at a 35-hour work week, reduced by 50. As of now, no one is in the assessor's office has chosen to take any time off. So, and then she said if necessary, they could cut $5,000 out of operating expenses. Noxious Weed Department, basically because everybody, when they come back to work in that department, works remotely and off by themselves, they're not really having to cut any staff because they'll be outside and they'll be distanced and in their own equipment. So doesn't see that being a priority. As far as cuts, she was obviously willing to give up purchasing a 4-wheeler, so that was good. We got the update from Extension and Senior Services and MOCO, so I will skip all of that. Road and Bridge, he said if he had to cut staff, he could do this. But right now, we don't see having to cut staff at Road and Bridge because they're all in their own piece of equipment. They're all in their loader, their truck, whatever. They have put sanitizer in the trucks. I believe they are going to, this is your truck until this is over, no swapping vehicles. So it's one person, one piece of equipment for now. He did mention being able to, he talked about going to shift work in his email, but recommended against it because of the hazards of working at night and stuff like that. And I think with infrastructure being critical and the ability to keep them separated, we just let them keep going on. And he did find some money that if he was asked to reduce, he said he would start by getting rid of extra road projects. I don't know that we're there yet. And then he came up with other money, another 150,000 plus or minus that could be moved from various areas of his budget and operating.
Go back over to that, where you can read it. That pertains to the chip seal, and so the chip seal, we've already got the grinder here, and
it's already started. At least on Road S, I don't think you have the opportunity to stop now. You're already going.
No, but why would we stop it?
I think that's just a grinder. He's not. I think.
No, I understand, but if he's going to grind, I mean, he got the grinder. We're paying $28,000 for it to grind X amount of roads. Why wouldn't we grind all the roads that we hired the grinder to grind?
Yeah,
I think he is.
I think
that's what
he's
saying.
looking
He
at
is.
chip seal projects, not just necessarily the ones that he's grinding and stuff, but if push came to shove and he was in a financial crisis out there at Road and Bridge, he could back off of some of the chip seal projects as well as some of the asphalt overlays.
And I don't think we're to that point,
No, I don't
but
think
I
so
don't
either.
know that the feds and the governor are done killing the economy yet
I think
either.
these are just the asks, the way I read this from what
Right.
Shaka sent out, to where the items that we can't cut, if we're looking at the cuts.
That we have
because-
still total discretion on.
Right.
These we have total discretion on.
Right,
So
and
he's
that's
still grinding.
right. Okay, and I understand it's all preliminary, but to get a good grasp of all of that, I think that's why we need our finance director to come up here, please. So I in case there is a long-term financial, we get in trouble, and we need to save as much money as possible. So my first question is as Commissioner Ertel and I, when we came on as commissioners, there was $9 million in reserves. 2 years ago, before we spent the money to do the new courthouse, there was $36 million in reserves. So it went from $9 million to $36 million in, I guess that would be 6 years. So my first question is where did that money come from?
You're talking about 6 years ago?
I'm talking that from the time frame of 6 years ago until 6 years ago to today, there was $36 million. There was an increase from $9 million to $36 million. Where did that increase of funds come from to grow the reserve from $9 million to $36 million?
In all fairness, to answer that question correctly, I need to look back. But
Basically, it came from the taxpayers.
It's all from property tax. That's the
Right,
only
but
way we-
why is there an extra? So if you was to subtract 36 million from the 9 million, that would be, kind of drawing a blank here. Well, that would be 25 million. So if you was to take 25 million and then you was to divide that per year of 6 years, it'd be,
4 million, give or take a little over 4 million a year.
4 million a year. So my question is why is there an extra 4 million a year?
I don't think I understand the question.
Well, I think Commissioner's asking, how do we grow our reserves that much in that shorter period? I shouldn't say shorter period of time, but in that period of time of 6 years, how were we able to?
The only way to grow the reserves is to not use them.
Not spend the money, the
That's
revenues
the
that
only
you
way
have
it
coming in.
grows.
Sure.
Right.
Yeah, but still, why is there an extra 4 million? Where did that come from?
It would either be grant revenue if they didn't spend all the grants, or the taxpayers.
Grant revenue.
But typically, the grants get used, all of it gets used, because just like the weed department, and you're carrying it over and you're using it for something else.
No, this is actually, it's not, it wouldn't be grants, it would be.
Just general fund.
It would be
revenues.
general fund monies that
Then
we.
the only way it grows is to not spend it.
No, but I understand that. I don't think you're, my question is where did the 4 million come from? Where? So we do a balanced budget every year, but yet our balanced budget is growing by 4 million a year. On top of the balanced budget, it was growing 4 million a year. Where did that extra money come from?
I would have to go line by line and to figure out exactly where it came from.
Well, maybe you could, Joyce.
I mean, basically, you're taking in more than you're spending.
Yeah,
Right. I think that's what I've heard her say, is that
Yeah,
we
and
didn't
if you-
spend it.
and
It
if you-
wasn't
And
spent.
if you did have a balanced budget, you obviously you didn't consume all
What
of your
was-
revenues within that budget. There were changes or alterations or whatever.
And
in
then it
that
became a
budget where-
carryover out of that budget.
And so with our budget that we passed this year, what do you predict that is it going to be the 4 million again that would carry over?
No, because we're going to transfer out that 6 million, so you will be down.
Well, but that 6 million would be money that was transferred last year, so this is a new
We
year.
haven't transferred it yet.
Huh?
We have not transferred the money.
No, but are you following what I'm trying to say here?
But it's part of the whole
So we
budget
are-
for the year.
We are spending more this year than what we're taking in.
Yes,
Yeah, I understand, by 5 million.
6.
6 million, okay, but with the trend, there would still be another 4 million coming in. You see what I'm saying, the way that I explained it?
Depending on the expenditures.
Well,
Right.
we've already did the budget, so I'm saying that there should be, according to the trend, there should be $4 million extra coming in. Am I correct, or if not?
Which would be a net of 2, if everything went the same way it did last year.
If nobody kneecaps the economy, you might be right.
Okay. But I just want that to be taken into consideration when we are making budgeting decisions, and that there is this extra 4 million coming in every year.
More than likely.
More than likely. But as your job as a financial director, I'd like for you, if you could, to keep an eye on that and give us predictions. The other thing is the assessed value of the homes was decreasing because of the Tabor and the Gallagher Amendment, because the value of the homes were going up. So now we're going to be in a situation where the value of the homes might be going down. And then what that does is that takes the assessed value up. It works vice versa. It's like a teeter-totter, right? So we might also have an increase in tax revenue to the county because of assessed values going the other direction. So
And one thing, Joyce, I'd like for you to track through the assessor and the treasurer to see that when all of our Kinder Morgan payments from our court decision have been made and we have banked them into the county.
Okay.
Okay. And kind of, when you know that answer, give me a report on that.
Okay.
Okay.
I don't think we're going to see an increase. The valuations are already out for this year. So this
But
year is
next
set
year-
as far as that.
2 years.
Now,
Right.
2 years when they reevaluate them, that's when you could see that, depending on the situation we're in right now, of where that scale slides. It could be, like you said, it could be less, or it could be more. I mean, who knows where it's going to go right now, but for what we're looking at, I think those assessments have already been sent out. So.
Yeah, they
Right.
only
I
change
agree.
every 2 years.
Right.
Right, so.
So there's no way to, I mean, we're not, I mean, if we're trying to predict, it's going to be a little bit difficult to predict right now.
Okay, so where I was going in my report, if I can now.
Oh, yeah, go ahead.
Okay, so what I've looked at in addition to what all the departments recommended is because essentially the governor shut down most of the work in the state at this point, that we not cancel our projects, but we obviously have to postpone them. So the fairgrounds remodel, we budgeted around 200,000. We still have about 100,000 left for vehicle purchases. The $325,000 for roof replacements that we haven't awarded a bid yet. 80,000 for solar upgrades, replacing the commodity coolers, which may or may not happen now, and then the money that we set aside for possibly digitizing records. If we needed to, if this thing drags out and the economy's kneecapped and we have to jump in and help people with food, or there's something that needs to happen for our local businesses, I can see if we need to, we can tap into $1.2 million to help our citizens, besides above and beyond what the departments recommended. And I would say immediately, if we have to jump in, the digitizing records, we've put that off 20 years. We could put that off and make that 500 million, or make that $500,000 available immediately if we needed to jump in to bail somebody out at this point. So I just want the commissioners to be aware that if we have to actively get involved in the kneecapped economy or helping to get supplies for the hospital if it goes the other direction, this is what you're looking at to be able to free up immediately to be able to jump in and help. So I just wanted to make that available to the commissioners. So if a serious need comes up, either from the economy, from the healthcare district, whatever, immediately I think we could repurpose any of that money.
Right, and my comment is I went through everything, and this is my take of reading everything that you did. Basically, what I seen was, and I'm just going to be blunt, was we're going to shut down, but we're going to pay everybody to do nothing. And I don't feel that that's fair to the taxpayer to just shut everything down and send everybody home. And all of our 247 employees get paid, but our farmers and ranchers, restaurant owners, taxi cab drivers, none of them are going to be getting paid.
So I'd like to respond to that.
Go ahead.
Also in my email that I sent out, in addition to asking how they could social distance, I said before we pay anybody to do nothing, we'll come in at nights, we'll clean all the buildings, we'll sanitize every desk drawer, every doorknob, every keyboard, every computer screen, and then as the weather warms up, if we're still not past whatever the shutdowns are, my suggestion is that we take our staff, keep them outside, start at the south end of town at the RV park, start working north through the county, clean up all the graffiti, clean up all the weeds, clean up all the trash, so they're out doing something for their paycheck that benefits the county. I am in no way supporting paying somebody to sit at home.
Okay.
I don't think any
I
of
like
us
your
are
attitude,
supporting
Jack.
that.
I like your attitude.
That we're shutting down. I think the message we're trying to send is that we are open, and we are open for business, and everything is functioning. We are not shut down. We are trying to maintain our social distancing, and
we're greatly modified.
And we're modified, but we are not shut down at all.
Well, and I think we should encourage as much participation of our employees in their jobs as we possibly can. I think Shaq will make that clear. But no, we're having to operate on a different level right now, and hopefully it's a temporary. And we have to also look that our taxes are going to come in. There's going to be a lag in our revenue coming in. The assessors already and the treasurer have already made accommodations, as well as like the federal government. They put off tax day till July 15th. So we're going to see our revenues coming into the general fund are going to come in on a different level and a different speed this year, so.
Correct.
So we've got to keep our eye on the treasurer and the treasurer's office to see how those taxes are coming in, because.
And we also have a recommendation from the treasurer too, that came also in via email late last night.
Right.
And I'm trying to bring that up right now.
I think it's, here again, I don't want to say, we're not canceling anything. I think we're just on a delay or postponing it. But I think it's important that we do look at our funds and see what we have in case. I mean, we just had $100,000 of ask today, 2 items.
Yep.
Now, are we gonna, we don't have enough information to approve those yet, but how many more of those are we gonna get weekly? So I think looking at
and
it.
those are unbudgeted things. Those are asks that
Correct.
should have come back during our budgeting process. They're things that are coming at an odd time for us. So I think we have to really be cognizant and evaluate and look at where we're at financially, and have Joyce keep us abreast of what revenues are coming in and how that compares to our budgeted amount and how we're doing on expenditures. And we're gonna need to watch things fairly closely.
Very
for a
closely.
while.
Yeah, I agree. But we're not, we
But no,
haven't
we're not
canceled
shutting-
anything.
It's just
We're
like James. I
We're just
appreciate-
postponed.
Appreciate James. He ought to be in his office. I mean, there's no reason for him not to be in his office doing his work where he's got all of his equipment and everything to do his job by. And still comply with the distance spacing and all that other stuff. So, yeah, you use our heads in all this stuff and make the best of it we can.
Okay, so since Commissioner Candelaria brought it up, and it is on my list to get to, I forwarded you this email from Ellen Black, and first portion is from the state, that the state authorized county treasurers of the state of Colorado to take action to suspend or waive delinquent interest that may accrue pursuant to the provisions of 39-10-104.5 as a result of delinquent tax payments. Any action by a treasurer concerning such action shall be made available on the treasurer's website, electronic mail if possible, and automated messages. And the portion regarding the public trustee foreclosure sale, the state authorized the public trustees of the state of Colorado to take action to suspend for 30 days the operation of the following provisions, Article 38 of Title 38 of the Colorado Revised Statutes, concerning the foreclosure process, subsection 38, 38, 102, concerning deadlines. It goes through the subsections. This was an executive order dated March 12th, or March 20th, 2020, sorry. And this is what Ellen is asking the commissioners to approve to put on the treasurer's page. 1, interest for late first half payments we will waive interest for late first half payments made after March 20th when the order was signed through April 20th. And that number 2, ongoing foreclosures will proceed as planned. Newly submitted foreclosure packets and future submissions will be held for review and recording until April 20th. Should the order be extended, we will make best determination at that point how to proceed. So she's asking that any taxes paid delinquently as a result of COVID-19, that the penalties and interest be waived until that period, and that any new foreclosures be waived until April 20th, and that should this proceed, that they reevaluate at that time.
I think that's well said and well done, that our taxpayers need a break, and
That's a good ask. Do we need to take a formal motion on this, John? Do we need to formally act on this?
Correct.
Okay.
Basically waiving the fee or the
interest
of the interest of the.
But that came from
the state authorized
state, yeah.
the state authorized the treasurers to be able to do this, but did not say that they have to do this. She's saying let's do it.
Okay.
Well, can I just want to make a statement about it. So this right here is, we've got MB out there writing slanderous letters about the commissioners for not doing anything. And apparently she wants us to go in there to her home where she's holed up and hold her hand. But I can tell you one thing, if there is things that the commissioners can do to help our community, it's this right here. This right here is where you are, it's in our purview to make it as easy as possible for our constituents as far as waiving the fees. Road impact fees would be another one there. Less regulation, actually, at the county level is is the best thing that we can do for our constituents. We are doing everything in our power that we can to try to help our citizens. And I don't think just out there making a statement every day that it's going to be okay, you know, I'll rub your back, is not what they're looking for in their leaders. They're looking for in their leaders to do this kind of stuff right here. So I'm all for this.
So I would move that, if you don't have anything else, Commissioner.
No, I think.
That we accept our treasurer's request to post this online to waive the interest and fees for up to the 30 days or up until April 20th, or extended at that point if we need to.
Second.
Motion and a second to approve the recommendations by the county treasurer of Montezuma County as listed below. All those in favor?
Aye.
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 Okay, and then I need some guidance from the board. I've had at least one commissioner ask me to postpone the roofing bids at this point. How does the commission want to proceed with that?
I think everything here on this list, if we talked about it, I think it should be postponed, but not canceled. I don't want to cancel anything. I think we just look at it for, I'm going to be optimistic and say we're going to be out of this pretty quick, but I don't know. But there again, we still have the money, and if everything lifts and we're good to go, then we can put them back up and we can repost them. I do not want to cancel anything, just postpone them.
So again, I'm going to go back to what I said, that to me looks like we're doing nothing. And so why don't we prioritize some of these items and move forward? I don't understand why we went and do the fairground remodel when we already have the money budgeted there and there's nobody there. So wouldn't that be the perfect time to do the remodel when there is nobody there to affect the remodel?
I think it's wide open after the 18th is what Larry said. So any time after the 18th is wide open.
Well, right now it's open before the 18th too.
Well, true, but
it's open right now.
If it was going.
Yeah, I'd like for us to get a new county fair manager, our fairgrounds manager in place before we kind of pull the trigger on that. I mean, and I agree. The money's there and we've budgeted for these items. I think it's probably a prudent step to maybe put these on hold for 60 days, till May sometime possibly. By that time, I think we're going to have a real good idea of where this whole emergency, this COVID-19 emergency, how it's going to manifest, how it's going to play out, what some of the direct results are going to be to us, not just indirect and not speculation, but we're going to know directly how it's going to affect us and the community, and keep those, but put them just in abeyance, put them on pause for 60 days. I mean, it's not putting an end to anything in 60 days. I don't think will make a great deal of difference in what these projects are going to do, but it will give us a little bit of breathing room to see where we're going to come out, hopefully come out on the other side of this emergency, and hopefully get back to some normalization of our operations, of events that we're going to be doing, and that sort of stuff, and just give us a time to kind of put things on hold for a little while.
And I agree with that. I think we're just holding on to it until we get through this
kind of get on the other
incline
side
or
of
whatever
this
they
deal
want
a
to
little
call
bit,
it, so that we can see that the peak is flattened out.
I can see I'm going to be outvoted, but I look at this the opposite way. And the reason I look at it the opposite way, I happen to know a very large landowner, and when everybody was selling their land, he was buying it. And I learned from a very smart man, when oil prices are down to $21 a barrel, meaning that when we were paying 40-some dollars a barrel, then wise people, in my opinion, would go ahead with their chip seal because everybody else is selling, we should be buying. We would keep our employees in place. They're already going to work. We're already grinding it because the grinder's there, and I don't understand why we went and put the chip, maybe the overlays on hold, but why we wouldn't go ahead with the chip seal when the chip seal actually is all in-house. It's the
I think that
I don't think that's on here.
Yeah.
That's not on the table
Yeah, it
right
was
now.
actually on the.
It's not on here.
I'm only talking
He's
about
just
this list
adding
here.
up, this is all
okay.
we're
No,
talking
no,
about.
I'm not talking about
Okay.
Rob's, yeah, no, I'm just talking about these 6 items right here.
Okay.
Correct, and that's all I'm talking about.
Right. Okay.
That's
Doesn't
all
anything-
we're talking about are
Yeah. I'm
these
sorry-
items
I'm
that
sorry if
Shaq
you
has
got to
outlined.
thinking
Well,
that
we
I'm
had a
making
list. It was right before this
Right,
that gave the
that
whole
was all the
list.
departments said they could
Yes.
do this maneuvering, but this
Correct,
is the,
if
these are
we
the ones
have
Shaq
to.
said, yeah, that are
Okay.
immediate that
All right.
we can.
All right, well, I was.
That gives us at least the 1.2 quickly that we have if we have to do something with.
Yeah.
The ask was everything that he displayed. And like I said, we're grinding right now today. We're still moving forward,
Those projects are still on.
but that's what the department heads have offered up if we need to, if this goes longer than what anybody will anticipate.
Right, so when you said put on hold, you're talking about.
We're
this
talking,
right here.
correct.
Okay.
I'm with Commissioner Ertel with, I'm talking 6 items that's been
Okay,
outlined by
and I
our-
apologize, I was,
You thought we were all the way back?
I
to
were,
the
I
road?
thought we were adding everything together.
No, no.
No,
Okay,
that would
well,
be much
that's my
more than,
apology. I
that would
would-
be about 7 or 8 million. That's
I
not
was confused,
1.2.
so, all right.
This is just short, quick little,
Short-term stuff.
short-term stuff that we can get our hands on money quickly if we need it. But here again, I'm gonna be optimistic, and I hope that we're gonna get through this quickly. I'm just an optimistic kind of guy. Everything is postponed, but we will continue it as soon as we know that.
Okay,
So-
well, I'm on
You
board
good with
then.
that? Okay.
I'm sorry, I was confused.
Gotcha, no problem. Okay,
Uh,
Shaq?
Okay, next, all the information we've been putting out, the journal's been putting out, whatever, there's been a plethora of comments of everything's closed down, except for the marijuana dispensaries. And I think the governor's order goes into effect today that the marijuana dispensaries have to have, for lack of a better word, a car hop running the supply of drugs in and out to the people in their cars coming to buy it. The concern that people are voicing on our Facebook, on the Journal's site, emailing, some of which I sent to you, is that people are coming from 3 states where it's illegal, 2 of which are heavily contaminated with the COVID-19 virus right now. And that is a concern for people that that's attracting people who could potentially be carrying the virus to our community. I'm not sure what the commissioner's authorities are, because we've already, there's a moratorium on marijuana sales in the county. So I think the commissioners have already eliminated that several years ago from a county perspective. But does the Board of Commission want to speak to that? Do we want the health department to put out an advisory about marijuana dispensaries at this point? What are your thoughts?
I mean, if you read the order, they're just like a restaurant.
Mm-hmm.
So they have to comply with the same rules and regulations. If they're running a curbside business, I don't see how it affects us specifically. And it's within the city's jurisdiction. We didn't approve any of those. So
Correct.
those are within the city's jurisdiction. Those need to be going to the city. And I feel that that's the city's jurisdiction, not ours. And as long as they're complying with the restrictions that have been put forth, then they have the opportunity to stay in business also.
Yeah, I can't argue with that. If you're gonna do that, then you're gonna have to make the liquor stores start doing curbside service of the liquor stores, and so I just don't think it's in our purview to make a issue of that. That's city's business, city's tax, city's licensing, city's authority. It really doesn't It may affect us. Obviously, marijuana sales does affect the county. It affects our law enforcement, affects our jails, affects a lot of things. But we really don't have any say-so in it.
There is another issue that I want to bring up as far as people coming here that apparently also made its way around Facebook and on some sites. Some very nasty things were said about people who are in the same situation as we are, just because they happen to live on a reservation or have a different color skin than us. And I would like to remind people that people in a lot of areas of northeastern Arizona, southeastern Utah don't have their own Walmart. And there were some very illicit comments made that I'm not going to use again here, suggesting that they not be allowed to come here and to use our Walmart and our city market and be able to purchase the food that's available in Montezuma County. And I would like to just send the message out that we're all in this struggle together, and we're not going to starve anybody to death because they live in a different portion of our county or because their skin happens to be a different color than ours.
We are all in this together, and that's bizarre. Whoever made those statements that's kind of crazy, ridiculous. We are all people, and we are all in this county, and whoever needs to go to a grocery store can go to the grocery stores. We are not shut down. We are open for business. Don't hoard anything. Go shopping once a week like the recommendation is, or as you need it, but we are all together in this.
I didn't comment on the marijuana shops. I'll start with, I've never been to one, but if they sell toilet paper, I might walk in that store, so.
It's called hemp wipe.
Oh, really?
Hemp wipe, yeah.
Yeah, it'll help calm your butt down.
Basically, just everybody needs to create a calm out of this chaos. It is relax, wash your hands, cough into your shoulder, do the proper hygiene, and let's get through this together as a community, strong, and we'll be stronger for it. Stop this ranting and raving and losing your minds.
What else you have, Shaq?
I'm done until you're ready for me to start reading public comments.
Yes.
Good by me.
Continue.
Fire away.
Okay, so I'm going to read these in the reverse order of how they came in. And I suppose if anybody out in YouTube land wants to add additional comments at this point, that's fine. But
Do you have the capabilities of putting them on our screen while you're reading, or?
Possibly. You know what? I think I might. So,
Yes.
Thank you, George.
starting at the bottom, MB McAfee, thank you, Jim and Keenan, for tending towards cautiousness. Thank you, Shaq, for finding resources that could be used immediately. Larry Don, I do not want/need you to hold my hand or rub my back. I would like to assure you, MB, that the offer is still available. Susan Lysek said, thank you for waiving fees and interest as requested from the treasurer's office. MB again, it's possible the county will have to take back some of the $5 million you gave to the Road and Bridge Department in order to see the immediate health and welfare of county citizens. Susan Lysak, businesses will definitely need our help. Travis Custer, Shaq, I emailed you a public comment if possible to include. Let me open my email and see if I can find that from Travis. I don't even have my email open today. Well, that's opening. MB McAfee, Larry Don, thank you for the brief but important expression of can do that we will get through this together. Bernadette Cuthair, commissioners, thank you for continuing to include the Ute Mountain Ute tribe in our trying times. Be resilient and continue to move forward. Danny Wilkin, Shaq, is there a phone number to call in to the invasive species conversation today? Did we discuss invasive
Yeah,
species?
James brought that up.
Oh.
There is I think there's a multi-agency phone meeting going on today about that.
Okay, I don't know. James Dietrich, if you're still listening, could you come and let us know if there's a phone number for that? Let's see, where was I? Bernadette, Danny Wilkin. Danny Wilkin, although I would prefer to be at this meeting in person, I thank the county commissioners, administration, and all involved who make this live stream possible. Again, a shout out to our IT department for pulling this together. MB McAfee, thank you to Greg for exhibiting coordination with Laurie. Jim McLean, the IT department, is working to upgrade our Skype to Microsoft Team use. Then I gave the website. Bernadette Cuthair to Rick Torres, what is the website? That's why I gave the website. Good Shack, good job Shack being agile with all the reports. Lucia Bueno Valdez from the Pinion Project, could you make the documents full screen? Sorry I didn't get to that one in time. MB McAfee, is great to hear Gina express gratitude. Montezuma County, Bernadette, oh, I was telling her I would ask these questions during public comment, which were, is Montezuma County preparing a reserve food donation in case of stage 1? What are the logistics? How would the tribe be eligible for service if necessary to access food donations for the community? And I think that's ongoing discussions for social services and for the senior services and the different departments that provide food. I don't know that that's an easy question that could be answered right now. Did the commissioners want to chime in on that?
It is, and I think that as we step up our EOC, right now it's a virtual EOC.
Yeah.
We're just in day 2 of our new emergency manager, and we have to give them enough time to work. As they get into their planning stage of this, I think that we're going to have, the plans will start coming out, and logistically, how we're going to handle it if this does proceed to get longer. And I think the first place for us of what we just did today was capture that $1.2 million in case we needed something that we're on our own right now and the feds or the state hasn't sent anything down. So I believe we're working on that. It's just an ongoing, nobody gave us a playbook for this.
No, there's not a plan for this, and you can't, I mean, it's good to plan, but it's hard to plan when you don't know what you're planning for or what the severity is going to be, or, you know, as of right now, Montezuma County doesn't have a coronavirus patient.
Correct.
So we got to, and that's not to say we close a blind eye to that, but we've got to take this as it presents itself to us and deal with it as it comes to us, and be ready to act when we need to act.
Correct. And I would also echo what Commissioner Sukla said yesterday. I was also on the phone call with the Mountain Ute tribe. We do have a open means of communication with us and their council. So whatever it's going to be necessary, we're going to work together, and we're all going to get through this. And that includes Dolores, Mancus, and Cortez.
Okay. SSH Whitehorse, do you have plans for worst case scenario? And if so, when can the public get a copy? Also, worst case scenario, Ute Mountain citizens infected with COVID-19 and beds are filled. What happens to the Native American community? And I'm going to go ahead and take the liberty of speaking on behalf of the hospital here. I think the Native American community is going to have the exact same access to the hospital as everybody else.
Absolutely.
And I would agree.
Absolutely. Yeah. Always have and always will.
As far as worst case scenario plans, our health department does have pandemic containment plans. It's mostly written for the flu and not for this. but you can make a query request and send that to Karen Dixon, and she can give you whatever the updated versions are. Also, SSH Whitehorse, if you are in tribal government and you shoot me your email address to spowers@co.montezuma.co.us, I can give you the invitation to join the talks that we are having on Mondays and Fridays. Susan Lysak, Dolores usually does around 22 Meals on Wheels on Mondays and Wednesdays. Not sure how many signed up. And then, let's see, good morning from the Ute Mountain Ute Tribe. Susan Lysak, thank you, Jim Spratlin. Elective surgery for veterinarians is to allow the shortage of PPEs to funnel to hospitals and public health.
So let me stop you right there, Shaq. I did have a a conversation yesterday with Susan and Rocky at the chambers. Not that they're ready to roll out any program yet, and but they are working with their ambassadors and trying to put together some kind of a plan also to help the businesses in our communities. So everybody is working on it. Like I said, we just don't have a playbook, and we're trying to do the very best we can to get it out there to see as quickly as we can what we're faced with. So the chambers are working on that for our local businesses.
Okay, and then Mindy Nelson retracted her message. Instead of John, there was a while there where nobody could hear Shaq. Karen Dixon, Jim is correct. The order states that elective veterinary services are closed. Dexter Gill said good morning, working well. Susan Lice, where did I go? Dexter Gill. Susan Lysak with the Dolores Chamber is watching. Lindsay Yeager, I don't know if she's still watching, but she said, and I let you know at that time, that if there were any particular questions for Southwest Health Systems, that she would be happy to answer. Did the commissioners have any questions for Southwest Health Systems? And maybe she'll type in a response.
I don't, not now.
I have none at this time. I've been following their Facebook pages also, and I think it's been very informative, so I have nothing for Lindsay.
And just for those who may not know, Southwest Health Systems, Monday through Friday at 4:30, they are doing a Facebook Live. They're keeping everybody updated on the COVID-19 situation, as well as responding to some frequently asked questions and answers. And on a few of them, they did respond to questions that people were typing.
I would chime in on that. One of the main concerns out there throughout the country is there enough respirators? Is there enough ventilators? Is there and I think that's going to be ongoing. I think we're all at the same time are going to be short. But my advice from some commissioners yesterday was we better try to buy it ourselves instead of depend wholly on the government if we think we're going to get ahead of the curve, because usually we'd be better off trying to take care of ourselves. If there's in all a way possible. One of the things that was said, and I'll announce it here if anybody's out there, you need a mask, that somebody said that you could still go to your auto parts store and they had all kinds of masks. So I don't know if that's true or not, but you might want to check that out. And we're going to have to take care of ourselves on a lot of this stuff if we're going to get it done and take care of our citizens.
And I agree. I think that we should depend on ourselves right now, specifically, because I think we're going to be more responsive to our needs than anybody else.
We're here.
We're here.
We're here, yeah.
Okay, and I did find the letter from Travis. I'm trying to blow it up big enough where I can read it off of this screen. But this is Travis Cut Hair, 40160, Road J, Mancos, Colorado. If it is, and I said cut hair, I meant Custer. If it is possible to slip a comment and see below, I'm wondering what the thoughts are on the county acknowledging the presumed positive cases unable to be tested. And I just want to interrupt right here. A presumed positive is a very specific term from CDPHE that means the first test has come back positive. So a presumed positive case unable to be tested is not what's actually happening. But if so, I'm going to assume now he's talking about somebody displaying symptoms but unable to be tested. So cases unable to be tested but still sending folks home to isolate. I have now heard of another case this morning, a colleague in La Plata who drove to Southwest Memorial to try to get tested, has all the symptoms, flu test came back negative. However, he was told they would not test for COVID because he didn't meet one of the standards, which was having been around another known positive. They told him to presume he has it and to self-isolate until 72 hours after his fever drops. He has a current fever of 102, up from 98 degrees this morning. The failure, ? How can you know if you've been around a positive case if there are no tests being done? Another case sent home without counting it. Granted, he's a La Plata resident, but if we think viruses stop at county lines, we're sorely and gravely mistaken. If the county and hospital wants to get a handle on this and consider it a public health emergency, they need to be clear, honest, and transparent. Tell the community the actual criteria for testing and tell the community there are presumed positive cases in our area and presumed community spread. Again, a presumed positive is one that has received a positive test from CDPHE. With an RO of 2.5 survey, Southwest Health Systems understands the rapid potential for transmission of cases that may be going undetected. The system is absolutely flawed if the community believes there are no cases locally, yet people are being sent home and told to presume positive. If tests are available, use them to identify cases and clear up the confusion about what symptoms will and won't be tested. Clear on the hospital website for everyone in the community to see, and in Spanish for all members of the community to clearly understand. If tests aren't available, it seems the county should tell the public, along with an underlying assumption that if the hospital and county can't prove they exist, we must expect that they do. So I'd like to start by clearing up a couple of things on this. One, the hospital does have test kits. The concern with saying how many they have is if we say there's 20,000, then everybody wants to be tested regardless of symptoms. If we say there's only 30, they say we're inadequate. The hospital does have test kits. They have guidance from CDPHE on what the signs and symptoms and conditions are to use those test kits. And I would ask, I don't know if Lindsay Yeager is still listening, but I assume you are. And so Lindsay, I would ask you if you can to address the testing criteria when you do your Facebook Live at 4:30 today. If you could address that so that everybody in the community does understand what the testing criteria are. But I want to correct the use of the word presumed positive. If somebody's sent home with a fever and a cough, they're told to isolate. It's a precautionary measure, but a presumed positive means there has been, the first test has come back positive from CDPHE, and we have 0 of those in this community yet. And the hospital has been doing testing, and that's how the one case from La Plata County was diagnosed, because of the testing done at our hospital. And I'll let the commissioners chime in now.
I would just say he's asking a lot of good questions. That we don't have enough tests to go around as far as throughout the United States.
Correct, throughout the United States.
But we are working diligently to get as many tests in our county and the surrounding communities as possible.
But they are coming because nobody could anticipate this. There's obviously no way to have had enough test kits for every person available. So Travis, just hang tight. We're all in the same situation. The test kits are coming. We still have to, so that we don't waste a test kit, they still have to meet the criteria to be tested.
And not only that, the fact that it takes, once the test has been taken from the patient, we're talking days and weeks to get the results back.
Correct.
My mother was in a hospital in Grand Junction with pneumonia. They tested her for COVID-19. It took them 9 days to get the test results back to Community Hospital in Grand Junction to say whether she had it or not. So, you know, you've got to take in these factors. There's so much leeway in what you can do, what can be done, and what can't be done, that you make the best judgment efforts you can. And if somebody's exhibiting those symptoms, you tell them to go home and isolate themselves and stay away from other people. And it's not an easy scenario. It's nothing simple or cut and dried.
No, it's not.
And then, let's see, going back to the bottom now, Travis Custer says that I'm incorrect. And so we'll let Lindsay Yeager address that at their 4:30. I'm sorry, Bria, I think is how you pronounce this name, Bria Kinsella, says San Juan Basin Public Health has stated that community spread should be acknowledged. I understand that we are, I can't read that, it has me tagged in that. We are Montezuma County, but we have to acknowledge that there are people living in Montezuma County, and I think we acknowledge that. I would like to say, if you are symptomatic, stay away from other people. Don't come to work, don't go out if you're symptomatic. And if you need to be tested, call the hospital and they will give you directions, 970-565-6666. Bria Kinsella, and working in La Plata County who are transferring. So we have people living in Montezuma County and working in La Plata County who are transferring that spread across the mountain. To not acknowledge that is grossly negligent. We also have people living in Montezuma County who are working in Farmington and other places as well. We have people in Montezuma County that are working in Texas and Oklahoma and other places too. MB McAfee, Larry Don, these are tense times. Your comment to me was disrespectful. And if the commissioners...
Just like her comment to me in the newspaper was disrespectful. I catch you.
Okay, I'm going to give it about another 30 seconds. If anybody has a comment they want to type into YouTube, we'll wait about 30 seconds after my voice.
Do I hear a motion?
I have one last comment.
Go ahead.
Because I know there are some people that think or say that we have been doing nothing, but I'll tell you what, we have been more active in the last 7-8 days than I've ever seen us be active. Just because it's behind the scenes and you cannot see it does not mean that we are not working our off. So thank you guys. Thank you for the Zoom meetings. Everything that we are doing, wherever we're at, we're communicating, we're making decisions. We hired an emergency manager. We pushed those out quicker than we've ever done.
And we got
somebody on the ground running, right. And we are working diligently. So I just want to thank you guys. And like I said, there's no playbook to this, and we're making it as we go. And I think as a team, we're working good together, and we will get through this. And we are going to create the calm out of the chaos. So thank you.
And it changes daily. That's the thing that they got to know. We're making
sometimes
decisions.
It's changing hourly.
Yes, so we're constantly having to evolve on our decision making, but we're all in, and we're gonna continue.
There's another comment here from Bria. She said people across the region are being told that they should presume themselves positive and to isolate. Well, I'm sorry, Bria, if people are using the wrong terminology. But again, if you do have symptoms, we do encourage you to isolate. You might be using CDPHE language, but people are being told differently. And so I would ask Lindsay Yeager and Bridget at the hospital, when they do their 4:30 live today, if they could please address that. And then Bria's going on, as a person working in public health in both counties, I am appalled by your comments to this community who trust you to protect them. And Kelly Unrein says, if families are in need for emergency services, for rent, mortgage, utilities, etc., they can call the Pinion Project to seek assistance. And Kelly, would you put the Pinion Project's phone number up in the comments, and we'll wait just a few more seconds before closing the meeting for you to put the phone number in there for people to see, and then I'll read it out loud. I may be able to find it too. So the number for the Pinion Project is 970-564-1195. So if you or your family or a neighbor is in need of those services, 970-564-1195.
All right, commissioners. Shall we conclude the meeting?
I'm had all I need to say. I'll move we adjourn.
Second.
Motion and a second to adjourn. All those in favor?
Aye.
Aye.
Aye.